Good morning. All right. Holiday, the Committee on General Government Operation and Appropriations now called to order. I'd ask everyone that if you have a cell phone, put it on vibrate or turn it off. Okay? If I hear the phone ring, I'm going to ask you to leave. Don't pick it up, just walk out the door and then come back in. Okay? In compliance with the open government law, the notice for this public hearing were posted on GovGuam Public Notice Portal, GTA TV Channel 21, Docomo Channel 117, and live stream on the Guam Legislature YouTube, and disseminated via email to all senators and all main media broadcasting outlets on Thursday, December 19, and on Tuesday, October 1st. The agenda this morning is only Bill number 355-37, introduced by myself, Senator San Agustin, Senator Roy Canata, Senator Vice Speaker Tina Rose Munoz-Barnes, Senator William Parkinson, Senator Dwayne Snicker, Senator Amanda Shelton, Senator Chris Duenas, Senator Jesse Luan, and Senator Tom Fisher. An act to appropriate revenues, excess of adopted revenues in Public Law 37-42, the fiscal year 2024 budget law as enumerated in Consolidated Revenue Expenditure Report of August 24. Bill 355-37, a fiscal note request was requested on September 17, was received and disseminated to all senators via email by the Committee on Rules. Those participating on behalf of Bill 355-37 are invited to the panel. We have a list of folks. Dr. Dolores Lee, are you here? No. Former Senator Dennis Rodriguez, not here. Terry Quambo, okay. We have, remember when you sign in, if you don't check mark that you're gonna testify, I'm not gonna call your name, I'll just say that you're here. All right? Summer Medler, please come forward, ma'am. When I call your name, please come forward to the panel. All right? We have, whose phone is that? Good. Okay. Ms. Lillian Pasadas, GMH, ma'am? There's probably others. I'm going to call all the names and so we can see how we can fill up the panel as much as possible. We have Ms. Melissa Wbel, okay, ma'am. Rachel Field, okay. Eva Ugen, not here. Okay, we have James, former Senator James Pardo. Sir, you marked you were going to oral testimony. And we have Ricardo Sablan. Many others are listed, but not for testimony, okay? So don't feel offended if I didn't announce your name. I can announce that later, all right? The general rules for this public hearing. Please provide my legislative staff with any documents for photocopying and distribution. Panel members are asked to remain in the room for questions or additional testimony as may be desired by members of the committee. Question and testimony shall be confined to the substance or nature of the agenda, which is specifically Bill 355. Personal inference as to the character or the motive of any senator or any individual testifying is not permitted. Any violation of this general rule of conduct will result in the removal of the public hearing room. Proper form and decorum shall be practiced by all present in the public hearing room for these proceedings. Individuals who fail to maintain proper form and decorum will be restricted from participating and will be removed from the room. When you speak, please make sure that the microphone is on and that you speak into the microphone. You state your name and title for the record. I'd like to thank my colleagues that have joined me this morning. We have Madam Speaker Terlai joining us, my Vice Chair, Senator Telo Tarigui, and Senator Chris Barnett. And with that, I will now give my opening before I ask the panel members to give their presentation. We also have Senator Brown has also joined us this morning. Bill 355-37 COR, introduced by myself, Senator Augustine, with fellow co-sponsors, Senator Roy Canata, Vice Speaker Tina Rose Munoz-Barnes, Senator Will Parkinson, Senator Dwayne Nicholas, Senator Amanda Shelton, Senator Chris Duenas, Senator Jesse Lujan, and Senator Tom Fisher. An act to appropriate revenues in excess of adopted revenues in Public Law 37-42, the fiscal year 2024 budget law as enumerated in the Consolidated Revenue Expenditure Report of August 2024. Although I am the main sponsor of the bill, this bill is not only mine, but a combination of most amendments that were proffered in Chapter 11 of FY 2025 budget session. To preface, we have crafted this bill with the mindset that although everyone may not get their desired level, multiple agencies would still receive necessary funding to alleviate any losses. This bill aims to allocate excess revenues from fiscal year 2024 budget to various essential services and projects that will improve the lives of our people. Some of the main areas that these appropriations focus on are education, healthcare, public safety, and economic development. For education, we have identified to appropriate over $10 million to support the Guam Department of Education for school maintenance and repairs, as well as parent-teachers organization. We've also identified $2.8 million to the Guam Academy Charter School to increase student capacities at various charter schools to meet the growth demand. For healthcare, there was a debate during the budget session that Guam Behavioral and Disney were being underfunded. Thus, we have identified $750,000 to Guam Behavioral and Health and $750,000 to DISIT to fill this void, as well as $2 million to the Guam Cancer Trust Fund. Furthermore, as we prioritize public safety for our government, we allocated $2 million to the Guam Police Department for necessary HVAC forensic facilities upgrades and additional funding for law enforcement recruitment cycles. Additionally, we believe economic development is crucial for the prosperity of our island. To support our local economy, we've allocated $500,000 to Guam Fishermen's Co-op, $1 million to the Guam Housing Corporation Housing Trust Fund. We also provided $1.9 million to the Guam Community Colleges for Wichi Scholarship to support student education. The bill represents a balanced and responsible approach to utilizing our excess revenue to address critical needs and improve the quality of life for all residents. While I'm committed to the funds allocated for Chapter 11 amendments, I'm also open to discussing the possibility of reallocating the funds to other areas of greater need. However, it's important to remember that these specific funds were included in this bill due to my promise to create a supplemental bill solely addressing the FY 2024 excess revenue amendments. Understand that during the budget session, I made that commitment when all these amendments were proffered, and it was by the body that said we need to stop because the amount of money that we were trying to introduce in the budget bill was beyond the $37 million. So that's how this bill came about. And through the discussion today, and through the committee, and when it gets to the floor, this can change. Okay? What's being appropriate can change. Or what's offered on the bill can change. This is not a solid bill that's going to stay forever. No. Based on the testimony and the support of my colleagues, it can change. Okay? I urge you to support this, and then I ask my colleagues, urge them to support this legislation and join me in building a stronger, more prosperous and healthier Guam for generations to come. And with that, we will now begin testimony. And we'll begin with, I think it was Terry, identified you first, right? Okay, you be first, sir. And we're going to go down the list based on who I called out first, okay? Thank you. Go ahead, sir.
Good morning, Hafaday, Senator Agustin, and the other members of the Guam Legislature. My name is Terry Quambo. I'm the Executive Director for Guam Cancer Care, a nonprofit organization geared at providing direct support services to cancer patients in the form of patient navigation, financial assistance, transportation, screening, and early detection. Guam Cancer Care is celebrating 13 years today, and I'm pleased to say since our inception, we have served over 4,000 Guam residents afflicted by cancer. We brought in over $31 million in outside resources to our Guam residents who have cancer. We issued out over $2.1 million in financial assistance award payments for these patients. We've issued over $600,000 in patient supplies. These are Glucerna, Ensure, colostomy supplies, adult diapers, wipes, and wheelchairs and rollators that are needed and prescribed by cancer providers. I want to take a different approach in my oral testimony to provide more color on the humanistic side on how impactful the Guam Cancer Trust Fund and those nonprofits, organizations funded under the GCTF provide critical direct support services to Guam residents afflicted by cancer. First and foremost, I really want to thank the senators of the 30th Guam Legislature, spearheaded by Speaker B.J. Cruz. In 2010, they had the foresight and wherewithal to create the Guam Cancer Trust Fund under Public Law 3080, a fund that not only raised tobacco taxes, which was a key deterrence in having people quit smoking, but the foresight to have these needed, to have sin taxes allocated to a fund that will take care of cancer patients needing much needed access to care, but to receive direct support services as they navigate through the cancer continuum of care. So kudos to those 14 senators in 2010 who unanimously voted to create the Cancer Trust Fund, which included some of the senators here today. Senator Telo Tadegui, Minority Leader Frank Blas Jr., and Vice Speaker Tina Munoz Barnes, who were at that time there to really push us through. So thank you to you 14 senators back then. A couple of minor stats I wanted to share. In the United States, billions of dollars are spent on cancer treatment. According to the National Cancer Institute, national costs for cancer were projected to be $208.9 billion in 2020, also known as the financial burden of cancer. In reference to cancer research, the federal government appropriated $7.2 billion in FY 2024 to the National Cancer Institute, who is the federal government's principal agency for cancer research and training. While there are billions of dollars allocated for research, no federal funds are allocated to support the out-of-pocket costs for cancer patients undergoing treatment. Let me be clear, cancer research is extremely important. We all understand that the advances in therapy really revolutionized the treatment. Radiation therapy was created. Those are important because it increases survivability to cancer. But on the flip side, these treatments are expensive and unaffordable to the average citizen. For example, billions of dollars are spent in development of new chemotherapy drugs where, when once approved and sold in the market, can cost between $10,000 to $40,000 per bottle. We have been bringing in these drugs for cancer patients, and I was told not to bring and show them because it may be illegal. So hopefully one of our patients here today can showcase what we do for them, but it is expensive, and you guys all know that. With the creation of the Guam Cancer Trust Fund, not only did it level the playing field for cancer patients to access much-needed care, Guam cancer patients are at an advantage compared to cancer patients stateside, and specifically in the Micronesian regions, to include but not limited to CNMI, Palau, FSM, RMI, and American Samoa. The GCTF funds provides patient navigation, financial assistance programs, patient supplies, off-island and on-island patient transport programs, lodging assistance, to name a few. But with that being said, I wanted to kind of share a couple of examples to show the humanistic side of what we do. When we first started 13 years ago, when we opened our small office, maybe 200 square feet, one of our first cancer patients was a 6-year-old female Chamorro patient. And I'm not sure if you remember how we got started and I'm not breaking any HIPAA laws, but there was a guy by the name of Ryan Regis. He was under Medicaid, and the doctor said he needed a bone marrow transplant, but it wasn't covered under Medicaid. And somebody thought that I worked for public health, so they referred him to me. And I was sitting at my desk, and we're looking in the AS400, and I found $2 million in a dormant account under GITA. I went in 2011, freshman Senator Dennis Rodriguez, we went to him and we said, hey, let's take that money that was earmarked for GMH to create a radiation therapy a clinic, but Island Cancer Center was already established. We took that and we drafted a bill to create the Guam Cancer Assistance and Treatment Program. And the intent of the law was to use that money to help patients get cancer treatment that were not covered by Medicaid or their insurance. If you guys recall, those that were here in 2011, it was the fastest bill that was introduced. Senator Rodriguez introduced it on a Tuesday. He said, Terry, we're going to have to wait 5 days for a public hearing. The Rules Committee, Senator Rory Respicio put it in the agenda, and we heard it. Ryan Ray just came and he testified. That's why it's public record. I'm not violating any HIPAA law, but it was passed. You guys unanimously passed the GCAT law, and I emailed all of you guys that night, and I said, hey, you guys need to do this for Ryan. And then Governor Eddie Badacavo was off island, and I was emailing him and messaging him. He called me and he said, come to my office on Monday, we'll sign it into law. We came to his office and he signed it into law as he promised, and we sent Ryan to City of Hope that Thursday through Public Health. And today he's still alive and in California. So it's because the fortitude of these senators at the time and that Ryan is alive to this day. Trickling down 13 years later, it's because of what we did for Ryan. People said, what can we do can you help us? There are thousands of people in Guam who have cancer and not only are we helping them, this Cancer Trust Fund dedicates a specific funding source. And if you read the law, which was codified into Public Law 3080, which was codified into 11 GCA Chapter 26, I just wanted to provide clarification. The intent of that law, what Speaker B.J. Cruz did was that money under the Healthy Futures Fund, if you read the law, it says the legislature can appropriate up to 72% to all these other medically related, public health, Guam behavioral health. But the 28% was earmarked. 15% was supposed to go to the Guam Cancer Trust Fund. 12% was supposed to go to GMH. And the 1% was going to the Cancer Registry. So for the last 13 years, I didn't understand how it's always going through legislation. Maybe it's a notwithstanding clause that you guys reference, but the intent was that was a dedicated funding source. And it was really disheartening to know that this year we only got $1 million that was earmarked, and I appreciate your comments of why that had happened and the need to implement this supplemental budget bill. But really, we shouldn't be going through this process. The intent of the 30th Guam legislature was to earmark that fund. And it clearly said that money was supposed to go to UOG and the Cancer Trust Fund, and they were supposed to appropriate 75% of the pot of money every year. So with that being said, it's important that we support this supplemental budget bill, specifically item Q, that appropriates $2 million to the Guam Cancer Trust Fund. With this, I close.
Thank you, Terry. Next, we have Summer Medler. Ma'am.
Hafizis and buenos dias, Senator Joe San Agustin and fellow senators of the 37th legislature. My name is Summer Medler, and I am a registered nurse and the director of operations for the GRMC Cancer Center. I'm here today to express my strong support for Bill 35-37, which allocates $2 million to the Guam Cancer Trust Fund. At GRMC, we treat our patients like beloved family members. This dedication extends to our relationships with organizations such as Guam Cancer Care, the American Cancer Society, the Edward M. Calvo Cancer Foundation, the Adjuda Foundation, and more. Organizations that provide critical support to our community and directly impact our collective ability to deliver compassionate and effective care. In my 9 years at the Cancer Center, I have witnessed firsthand the significant effect these organizations have had on our patients. I have seen them in tears, struggling with the debilitating side effects of their disease and the treatment intended to cure them. Patients who struggle to eat or speak, patients who require colostomy bags due to surgery, patients suffering from limited mobility due to their cancer metastasizing to their bones. The support of the organizations funded by the Guam Cancer Trust Fund ensures that these patients can receive vital resources free of charge. I believe that reducing funding for these organizations will lead to dire outcomes for our patients. Patients can procure costly specialty medications and nutritional supplements with a simple phone call and prescription to Guam Cancer Care. Patients who have undergone colorectal surgery can obtain colostomy bags, bedpans, and gloves. Patients can acquire wheelchairs to alleviate the physical pain stemming from their mobility issues and bone metastasis. For patients needing off-island medical care, the Aduda Foundation covers the cost of airfare for the patient and a caretaker. Gas cards from the American Cancer Society help ease the burden of travel for the countless miles driven to and from treatment. The Edward M. Calvo Cancer Foundation and Guam Cancer Care offer annual and quarterly financial grants, respectively, helping to alleviate the financial strain on our patients further. At GRMC, we believe that we all serve the same population with the common goal of providing the best possible care to our community. We have made cancer care a pillar of our hospital, and we believe that the collaborative partnership between GRMC and these organizations is more than a professional relationship. It is a team effort that gets patients through their darkest days. Above all, we recognize that this effort has helped GRMC make significant strides in ensuring that patients have access to comprehensive quality care. We also realize how heartbreaking it would be to see that support disappear. I urge you to consider the profound impact this bill can have on our patients, healthcare providers, cancer organizations, and the rest of our island. Together, we can continue to advance the fight against cancer and improve the quality of life for those affected. Thank you.
Thank you. Thank you, Summer. Next would be Ms. Pasadas from GMH. Ma'am? Remember, I'm just going down the list, huh? No preference.
Thank you. Good morning. My name is Lillian Pasadas. I am the GMHA administrator. I'm here today in person to express my extreme disappointment, dismay, and indignation regarding this bill number 355-37. I'm not against it. I'm just disappointed. The bill proffers the appropriation of $36.7 million from the revenues collected in excess of the adopted revenues in Public Law 37-42, which became, as amended, the fiscal year 2024 budget law. The appropriation of $36.7 million will be divvied up throughout the 20 agencies and organizations, and yet absolutely nothing for the one and only public hospital that deals with the island's health, life, and yes, death. We deal with that. In May of this year, the acting hospital administrator, CEO Dr. Dustin Prince, presented our fiscal year 2025 budget request of $74.3 million, subsidy from this legislative entity, but only $37.7 was approved. Senators, I'm not here to make any accusations or put any blame on anyone or to cut any appropriations to the agencies and organizations specified in this bill number 355-37. I am here to advocate for and speak on behalf of our public hospital for this legislative leadership to appropriate the remaining $37 million of the $74.3 million budget request for 2025. It is within this legislative leadership's authority, power, and responsibility to appropriate funds for the island's one and only public hospital. Therefore, I am begging, and pleading this legislature to please appropriate the $37 million to the Guam Memorial Hospital. Thank you, Senator San Agustin, and all the senators here for listening to my plea. Thank you.
Thank you, Ms. Pasadas. I'd like to also recognize my colleagues that have joined us this morning, Senator Tom Fisher and Senator Chris Reyes. Next would be Melissa.
Thank you, Senator San Agustin, and thank you, senators, for being here and for this proposed bill. I am actually here in support of this bill, specifically for the funds that are being earmarked to go to the Guam Cancer Trust Fund. My name is Melissa Wbel. I am the CEO of Guam Surgery Center and Island Cancer Center, and I also am a nurse, so I do jump in and I give care to patients. I've seen some today already, and I'm really grateful to see them in this audience as well. Seeing firsthand what cancer does to a family is a difficult thing to watch, and so having people like Terry Quambo and Guam Cancer Care who really stepped up to the plate and provide services that just are not available on island without them is, it's very heartening, and it is absolutely necessary for those patients who are undergoing cancer treatment. It is time-consuming. For those of you who are not familiar with radiation therapy, it requires patients to come every day. So they are there 5 days a week, and depending upon what type of treatment they're getting, it may be for 5 days, it may be 1 day, it may be 44 days. It's a long time, and they have a co-payment every day. They have to get there every day. Treatment builds on itself, and so your fatigue factor gets worse as time goes on. We have so many on island who don't have the resources in order to get the kind of care that they need. Guam Cancer Care provides that. They've already talked and spoken about some of the things that are offered, but I'm going to speak about one specifically that I see impacting our patients on a regular basis, and that's transportation. If they don't qualify, and many don't because they aren't sick enough to get medical transport covered by their insurance, whether that's Medicaid, Medicare, or otherwise, they have no way to get to us. They have no way to get, imagine being told you have cancer and you can't get treatment because you don't have the wherewithal to get in a vehicle and get to the space that can help you. Guam Cancer Care fixes that. They pick people up. We work hand in hand with them about trying to coordinate care with medical oncology as well, so that it's easier for these people to be able to get transported, treated back to back, so that they don't have to make multiple transport trips. These things are super important to the patients, but they are to us too. We really care about our patients. We want them to do well. We want them to get better. Yeah, do we provide charity care as well? Yeah, that happens too, because people need to be served. We don't make potato chips. It's a whole different ballgame when you're dealing with people, and we treat them exactly as we would want our loved ones to be treated. And how do I know that? Because we've had some of our own that have to be treated as well. We don't treat anybody any differently. We respect every person, and this money that's going to go to them will be put to excellent use. The only other thing I would echo is what Terry Quambo said in his statement. I went back yesterday and spent a lot of time looking at the bills. The original bill 3080, I was here for that. Also, I looked at the funds that were supposed to be appropriated. And every year, there's only been 1 year in the last 14 where the Guam Cancer Trust Fund actually received the 15% that the law said it should get. Every other year, they have received half or less than half of that amount. And I think about all the good they've done with the little they've received. How much more could we have done had they received what they were supposed to? Thank you again so much for this opportunity to speak to you.
Thank you, Ms. Rachel. Eva Ugen. Oh no, she wasn't here. Move along. James Paudon, former Senator James Paudon. Oh, is Eva here? And just grab a chair so she can sit there. Eva, yeah.
Sorry.
No problem.
Half-a-day senators, good morning. I was really hesitant to provide oral testimony today, only because my emotions tend to get the best of me. I am here to testify in strong support of Bill 355-37 in support of the Guam Cancer Trust Fund. Throughout the years, I've had the honor and the privilege of seeing Guam Cancer Care grow from its infancy stage into what they are today. And it is disheartening to even conceive that a budget which has saved many lives was even being considered being cut. They've spoken on their transport services and their supplies, but I don't think, I guess I'll go ahead and highlight their patient navigation services. and what it has done to cancer treatment on Guam. When you think about cancer costs and cancer drugs, and Terry kind of leaned into saying that it costs anywhere from $10,000 to $40,000. One treatment every 28 days for 17 courses. That is $150,000, $117,000 per year, per person, per treatment. And these treatments can go on year after year after year. Unfortunately, when it comes to insurance coverage, they are underfunded in terms of zero coverage, sometimes 20%, sometimes 30%. Lately, it's been 50%. That the patient share is 50% of the cost of their treatment. The most difficult part of that is even with Medicare, they have a catastrophic coverage clause. And you don't have to answer the next few questions. It's just questions I'm putting out there to provide that visual for you. If you are covered by the current Gov Guam plan, a lot of your medications aren't on their selected formulary. And what your insurance has chosen to do is they have chosen to say that these drugs are not covered because they are not explicitly on our formulary. But we're going to do you a favor today, and we're going to cover you at 50%. 50% of a $40,000 drug is $20,000 that you have to come up with every 28 days. Not just every 28 days, but every 14 days, because we have to allow the time for the drugs to be shipped to Guam. And these drugs will not be shipped to Guam without payment first. What Guam Cancer Care does is they help find the funding to help these patients pay for their out-of-pocket costs for their drugs. And without that, put yourselves in these patients' chairs. How many of you are GovGuam members? How many of you have family members with cancer diagnoses? Immediate family members, which puts you at higher risk of cancer yourself, which puts your children at risk of cancer. How many of them will need their services in the future? By not funding this bill, you're basically saying that people no longer have access to care that can quite literally save their lives. Cancer treatment is so advanced nowadays that they can specifically tell you what drug will benefit your cancer just by taking a genomic sequence of it. But without the funding to help support it, these patients don't have access to that care. So I beg you to please support and fully fund the Guam Cancer Care Trust Fund. Thank you.
Thank you, Eva. Former Senator Sablan, sir, you're next.
Thank you, Mr. Chairman. Good morning. Good morning to all the senators up there, Speaker Jalahi, Senator Barnett, Senator Brown, Senator Tydegui, Senator Chris, Senator Fisher. Good to see you all here today. I've always lived, every time I had the opportunity to speak, I've always kind of lived by the 3B rules that my wife constantly puts in my head. And that's be sincere, be brief, and be seated. Well, I'm seated, so now I'm just going to go ahead and be as sincere as I can be and be as brief as I can be. You've all heard the testimony already that's been spoken. I am here representing Azuda Foundation. We have a program that is funded by the Guam Cancer Trust Fund called Wings for Life. This program basically is very specific. We help cancer patients who have been diagnosed but are being referred for off-island treatment. We help cover the airfare of the patient and a caregiving escort. The condition of this is that so long as their insurance companies does not provide air transportation, and they're a resident of Guam and they are diagnosed or are being referred, excuse me, for further diagnosis off-island. There are a lot of cancer patients on this island. Unfortunately, our capability to assist these cancer patients our residents, our friends, and I'm sure everybody here knows somebody who is, or some family who has been afflicted with cancer. It gives them an opportunity. This program, our program, gives us the opportunity to help these cancer patients seek the treatment they can get elsewhere, but is not available on this island. The Guam Cancer Trust Fund, again, you've heard from other organizations and other entities who work with cancer patients. Bottom line is this. On this bill, of the 21 entities of which appropriations are being requested for, right? Subsection Q, which basically appropriates $2 million to the Guam Cancer Trust Fund, is the only, and again, I know this is subject to debate, is the only subsection in this bill that directly deals with current life and death situations, being able to address it. We have existing patients. We have patients in the system, you've heard from the other organizations, who have been diagnosed, right? If the funding does not come through, that extra $2 million, which is basically the appropriation that's been given to the Guam Cancer Trust Fund these past few years, if we keep it at the $1 million level, which is what was passed in the recent budget bill, then you're going to see a lot of the programs fall by the wayside, including ours, right? We will not be able to get patients to treatment. And please understand that cancer isn't just one form of cancer. There's so many different forms of cancer. I mean, we can talk about, we hear about lung cancer, breast cancer, ovarian cancer, but then there are other kinds of cancer that I've had to look up and ask medical professionals, not here, but in the States, what exactly is this? Recently, I had a cancer patient who came in and asked for assistance because they had a cancer of cartilage. It had some strange name. I had to look it up, what it meant, right? And it's a cancer of the cartilage. I've never seen that before. I've also had in a case where I forget what kind of cancer it was, but normally it affects elder women, 55 and over. I had a patient who was 22 years old, and even her doctor was saying, I've never seen this, that someone so young would be afflicted with this particular kind of cancer. And so please understand, it's a very serious situation on this island, and you, or this body, has the opportunity to help, right? And really, like I said, this is the only item on this bill that directly affects a life or death situation that exists today. All the other appropriations that are proposed in this bill definitely have merit, but they're for ongoing operations or things that will happen in the future, but none of them are addressing a life and death situation that is occurring right now amongst our people. Technically, and you've heard it from the other speakers, by law, the Guam Cancer Trust Fund should be receiving 15% of the Healthy Futures Fund. Now, when this recent budget bill came up and was passed, I had asked several of the senators why. Why is there only $1 million that's appropriated? And one of the comebacks on that was that, well, we see that the Healthy Futures Fund has decreased from about $36 million a year to about $23 million a year. And so I understand the challenge before senators to be able to appropriate according to what the revenue is coming into the fund. However, if you really think about it, and if you really just do the basic mathematical analysis, right, at $23 million into the Healthy Futures Fund, and if we take 15% of that, Guam Cancer Trust Fund should be receiving approximately $3.5 million out of that decreased Healthy Futures Fund revenue that we're anticipating for 2025. 3.5. That's not what this bill is stating. It's stating, well, let's appropriate $2 million to cover to help cover that $1 million that we gave in the budget bill. And I think we're all satisfied with that at this point. However, right, going forward, we're seeing a lot more patients coming forward, especially now, at least for us, especially now that the Philippines has opened up as an option. We started our program in the middle of COVID, so it was a very slow start. But through the past 3 or 4 years that we've, at Ajuda, have been in existence with our program, it has grown tremendously. When people hear about us, they know what we can do, we know what we can help with, they're calling. Patients are being referred from the Guam Cancer, Guam Cancer Care, from American Cancer Society, from all the organizations, from the Quambo Foundation, from even the Total Guam Foundation. They're referring them to us because that's what we do. We help these cancer patients get off island to the treatment that we don't have available on island. And that's very significant. It's very important. We've treated a lot of the patients, I will say, are just people that you know. I know you know them, or you've seen them, or you've interacted with them. And they come from all walks of life. A lot of them are just simple, hardworking people, restaurant employees. I have several gas station employees. I have construction workers. I have all kinds. Although we also have people who you think should be able to afford their own airfare. But it's like, I guess my mom would always say, even rich people, their bills are just as high as ours in proportion to what they make. And so their ability to go off island for the treatment that they need is not necessarily available at the time that they really need it. But those who do have the opportunity to get treated on island, all the other organizations do a fantastic job with the very limited amount of money that they have. A lot of times it's volunteer work. In our organization, for the 1,000-some patients that I've flown off island in the 3-4 years that we've been in existence, I'm the only one who does it. It's a one-man job that I have. And I don't mind. I mean, it gets busy and it gets heart-wrenching. People cry over my table because think about it. When you're first diagnosed with cancer, the mental anguish, right? The fear, the emotional drainage of what are we going to do? I've seen people mortgage their home, remortgage their homes just to be able to treat cancer, because you just heard the expense of it is fantastic. It's incredible. So they're pulling out of their own pockets. So when we talk about the $2 million that we're asking for in this bill, it's minuscule to what the patients actually pay out of their own pockets. But it's a good support for all the organizations who are doing something good. We're doing something in a nonprofit way, right? We're not benefiting ourselves. This whole thing is more of out of love for our island, out of love for the people who are afflicted. I come from a family of doctors, right? So I understand. We won't get into that. But please understand, there are a lot of different kinds of cancers that we cannot treat on this island. And if you cut the funding, or if you do not give the extra funding of $2 million, these people will die, literally. And like I said, this is, and it was mentioned before, this $2 million makes the difference between life or death for a lot of these patients. It really does. It's a process. Lung cancer, leukemia, all kinds. I can name at least 20 different kinds of cancers that have come through our doors asking for help. And we've seen all kinds, from young children all the way to people that you would never think would be afflicted with cancer, because you think, well, they've lived a healthy lifestyle all this while. And they say, I don't know how I got this. They don't smoke, they don't eat properly, they exercise and all that, and yet they still contract cancer. And their families do whatever they can. You've seen it. A lot of you senators, I know I was there, right? Whenever there was a $15 to $20 fundraiser, you go to those because you know what it's for. A lot of times it's to raise money for a medical issue or to go off island to raise money for airfare or lodging or whatever they need to be able to get treated. Our patients want to fight for their life. They do. Some of them want to give up. But when they come to my office, I encourage them not to. I encourage them to go ahead, seek assistance from the other organizations. I promise them that I will help them get to off-island treatment. And I will do so as many times as it takes, as long as the budget is there. Because treating cancer is not a one-shot deal. It's a process. Sometimes it takes years to be able to overcome. And even after all the treatment, sometimes it just comes back, or it spreads to other areas of the body. It's a serious situation. It's a very serious situation. And I'm going to reiterate what I said earlier. This appropriation that we're asking for will go a long way to helping these people, to give them hope. Because I think that's what all these organizations who take advantage of this money, of the grants that we get from the Guam Cancer Trust Fund, we give them hope, we give them courage, we give them incentive to continue their fight with determination. That's what their families want. That's what they want. They want to be able to see their kids graduate. They want to be able to live life. They want to be able to go back to work. And that's what this money does. It gives our cancer patients hope to be able to live a fuller life. And so I ask you, I can go on, but I know there's a lot of other speakers here, but I just wanted to emphasize how important this $2 million is to the Guam Cancer Trust Fund, and in particular to all the organizations who benefit from it, who then go out and help other people. I'm going to end with this. When a patient comes in after I help them, or we help send them off island, and they thank me, right? And I don't say, you're welcome. What I say, and I say this very sincerely to them, is that I am blessed. We are blessed. We are very blessed to be able to pass on blessings to you. And that's all this is. The $2 million, actually it should be 3 altogether. Maybe it should be 2.5 in addition to what you already gave the $1 million for. It's a blessing, right? And that's what we're asking you to do, is to help us bless those who are afflicted with cancer with this $2 million or $2.5 million in this bill. Thank you.
Thank you, former Senator Jim. I'd like to also recognize Senator Roy Canathas joined us this morning. Okay. Now for Ricardo Sablan. Sir.
Dispensada de pausa no neste. Cocina tausay lenguajita. Por favor. Tangklo na agradecimento para amdo tori man senador ganaulo palaan pa lahi sa dispensada kulat man lolo I borso sa primer brano tagino comentos gini gi legislatura. Lo bonito I uso popoti silo ki ma proponi na bill sa Pinonia si senyor dispensa tutungan ma. Si senyor despaudon neji gwalele kuna bonito sa gwa hasalapi ni ma proponi lo jangin sina mon mandanya hi Prophet ini partida ko Demokratu per Republican ko unu na partida zaman asoju it man za tatsagi muna lugar de ezwa na slopi imar matsuda gwatu sianu slopi po majuda stisena organisasioni mantena tampi nestina slopi wahuloki no masngonyo na kansetru stage 4 gi tolongum na hinap nista dan prostate cancer za ani finena masngonyo kulana ji kulan zombie statutungo fa prabisongan tayo gi first base masngonyo na sagi complaints masngonyo na stage 4 tada first base second or third leko ay pers of pagprata togile niya Ala na sa to amtio pes le kupes ngada prata sogino le na siguiente dia le kupes konsigi lo magard esti cancer care trust fund dongklusti na dudu sa ni marsangonyo tutungo padeno sa ti preciso lo jangina toko sti na chetnun sempre on ketungo afano na adudum gwagwaha gizungo afa possibly pes utungo paristi cancer trust funds ani ajudau I subrinao ani maniluan iago timanggonggung ani agang ulu no ti masangonyo le na hafana adudu sina be na ole ku an hafa genau gwaha wa gradesi pes magahi hasta lechi komunisita gumimin kluserna gwaha wa borsa jangin marsao tumalaika kasunes busa unuse kemun agwa bedliner prapon tampir prapon na mars sintodo jangin kumahulo guantis jangin marsao pon patsane borsa wipes gof ajudanti magadistina ahensya ne pes ani amut jangin ambe jang suka finoknya zakat riko sempino alatsai salapi musa jangin masangon stana kanseto nisita MRI CAT scan nisita pun palaki mediku nisita pun spia kadeta nisita pun sinuguni pura gastu lo wastu ni sina menyodau salapi wastu na lenda senior sina no ta judau ni amuliku ilana por favor de sa preciso bi sta dosonyo su tulisti na amu di kansen na amu zan wacha makimo madulu ko pesgana na ani unisita ma udai le na sinalokit inkenyo le ko por favor gatsu sa preciso pa be foto geno na sa sta masangonyo na waha mas para bimasangoni po di sinotu dati sina magar ti undia asti inatake inasomo gana ba na ang bawa na may gigima wasui seti man baba ne nasukulan si satanos mahalum da akike batanggo papagi maduknya le koy cham Lord dispensa sa kelen anunyu kutu Agustin usol singan lo maulik nagwan sinupoti sa gracias a Dios no inkalam titinis tisa adjudus tilay na ahensya todos ti cancer funds cover the circle of care sumono giza bulasya no na medico man mafatu za mangwekwentus pot cancer pot breast cancer todo pinatsa na kasenset kum cancer za ajudu pese tali man mafatu gi mina primed jante set na sobalu gi watu gi corporate office gi kauvu ni manalum sa guanu guatalu mangwekwentus mas por esti set nun after manu na judu manu na guasya no information jun sasangan por ajuda no hungu padena lo mas claro pa go na afano masu sesedigi za dongklen masin nei kinalam titini na asunto na lo tizau muna panen potsam dun esti historialo esti experience ya por favor fan etnon sojo aji sinano gai autoridad o gai forsani sina marsu managwahano salapi ni prapo ina judas ti sei tigwawa sa bula magar gini gi stisa familia utunga na kada familia le kustam experience wagi familia or isaina biya yamku ifamagun parentis ni man natokan istina na kadukun setnu sa taza amigunya pura enemigo jang penatso kulanaji ma fananan ma dev sentence la pwede mon guama sa dudu ginin esti un propopuni na bio sinyo ta todo amdu dongklu na agradecimiento dan tordi man ikunguk sidus marsi.
Thank you.
Algo más.
There's más, sí. That will complete the testimony of the panel. All right, the current panel. Now I'm going to open up for questions of my colleagues. Ma'am, I didn't call you? Really? I missed you?
Rachel Field.
Oh, Rachel Field. Sorry.
It's okay.
I skipped you
It's
and I
all
went
right.
to Eva.
Save the best for last.
Apologize,
It's okay.
please. Please, from the University of Guam. Go for
Thank
it.
you. Hafa good morning, Senators. My name is Rachel Field. I'm the University of Guam's budget officer, and my testimony is two-part. I'm representing the Guam Cancer Trust Fund, as well as the University of Guam. Bill 355-37 has two appropriations, one to the Guam Cancer Trust Fund and one to the University of Guam. And so the Guam Cancer Trust Fund did submit a written testimony letter, and I just will highlight a few of the sentences that we've written out on behalf of Dr. Yvette Paulino and Dr. Anita Borja Enriquez. And so we're basically saying that we are definitely in support of this bill, and we thank the legislature for putting this bill forward and all of its sponsors. The University of Guam continues to be good stewards of the Guam Cancer Trust Fund. As you know, a lot of these organizations go through a process, the council reviews, and then the funds get dispersed throughout the year. And so we're happy to continue to support that effort. And we just also want to reiterate the 15% mandate in the previous law, Public Law 30-80. So if you think of it just from a pure budget perspective, the fund was appropriated $3 million in the previous fiscal year, 2024. And in 2025, we were appropriated $1 million. And so you think about all of the funds we have dispersed for this year, it will be, if it was left as is, we would be $2 million less to provide to a bunch of these organizations that we've been supporting for the last few years. And so we're happy to see, we're happy to just ask for your support again for the additional $2 million. It does get us closer to the 15%, and we recognize, you know, the revenues are what they are for the Healthy Futures Fund, and so we just want to continue to see this process through. We want to continue to support the organizations that are funded through this fund. It is separate and apart from our operations. Obviously, there are other laws that are in place that keep this kind of, you know, closed in, and we disperse as the funds come through from the Department of Administration. So I do just want to highlight some of the direct services that the awardees, again, do support. So it includes gas cards for ground transportation, post-surgical garments, head coverings, patient education books, travel off-island, and for their escorts, respite care services, financial assistance for treatment, nutritional supplements, doctor appointments, cancer medication, and the list goes on and on for women's health care for at-risk women in Guam, testing and precancerous lesion treatment, and we really want to continue to support these organizations, so the additional $2 million will at least keep us at the same level of fiscal year 2024. So that is for the Guam Cancer Trust Fund. And I do also want to just say thank you again to the legislature for including the University of Guam. There is also a $4 million appropriation for the institution that will support deferred maintenance, our strategic plan initiatives, and things of that nature. And so just in the past few weeks, the president has presented our new strategic plan called Tulis Motna. And so the university continues to be excited to support the efforts of just seeing our students graduate, seeing research continue to happen, and seeing just a bunch of activity going on. And I want to thank all the senators who have actually come to our campus to see our facilities and the new buildings that are coming up. And so if you haven't been able to come, please come and see all the activity that's going on up there. We're more than just graduating students with bachelor's degrees. We're starting off our doctoral program this year, and it's just amazing, amazing work that's being done at the institution. And so I do want to continue to thank the legislature for their support, and that's about it. We do plan to submit written testimony about that part as well. So thank you very much, Senator.
And thank you, Rachel. I apologize for us
No
skipped
problem.
you. Anyway, going back now that all the testimony has been provided by the folks that are signed in. Okay, I know Senator James is pointing somewhere down here, but I think Jordan, you're later on in the list.
I signed on a little later on the list.
Okay.
I was a little bit late behind Lillian. So I don't have much to add other than I support Lillian's testimony, and the question should be not if GMH is getting extra funding, it should be how much. I know there's a companion bill that the speaker has put in for $20 million, and I think those things deserve a lot of debate because GMH always operates at a deficit and we need money to actually meet our legal obligations.
Understood. And earlier I didn't mention about the bill, okay? Bill identifies 36. I know for the Guam Cancer Trust Fund, that's there already. How we carve out the rest is another issue. With that, I'm going to ask my colleagues to ask any question. I'll begin with my Vice Chair, Senator Tydegui, and be followed by the Speaker. Then I'll proceed to the co-sponsors of the bill.
Thank you, Mr. Chair. Good morning to my colleagues, and most especially good morning to everyone who's here this morning testifying. I'd like to see this bill come out as the life-saving bill rather than anything else, because Senator Espaldon hit it on the nose. This money is needed for people to save their lives. Okay, I don't know if we're online now right now, so let's double check. We may have some technical difficulties right now, so we're gonna just take 1 minute to find out if we're okay. I'm seeing a nice doggy on the, okay, we're continuing to go. Okay, even though it's not on there. There we're back. Like I said, this should be the life-saving bill. All the funding, I truly support the funding going to GMH. First and foremost, that's going to help many people who are sick, who are in dire need. It's life or death. And of course, the Cancer Foundation. And Terry, I'm glad you brought us down to history and told us what happened, but Senator Espaldon was also one of the senators, too, that was there. And it's ironic that the two of us are here today. He works for helping people with cancer, which is an abnormal job. And I never would have guessed back in 2010 that supporting that bill that I would be in that predicament where I got cancer. And here I am today, trying to fight with all the warriors that are in this hall right now. Thank you. Thank you for continuing to fight for those of us who've been sick. I've been lucky, and getting through it, 7 years. And I was just so disgusted to see that in the past, how we've shortcut the Cancer Care Foundation when it was put in law for all these years. I don't know if Dr. Polino is in the house. Well, Dr. Polino put together a list of all the appropriations since 2020. Only 1 million, 2021 only 1 million. Then I remember in 2022, I went to the oversight chair and begged and pleaded to put more money into the cancer care, and which we did for 3 years in a row, $3 million in a row. And then here we are today because we know that the cancer care or the Healthy Futures Fund was lessened throughout the years, which is a good thing because less people are smoking, but now they're moving over to vape. So vape, we've also have a bill out there that's going to tax the vape. So hopefully they don't vape, but still, there's going to be money there. But what really gets me upset is that we have been subsidizing with the general fund other areas in the government of Guam that uses Healthy Futures Fund. So why can't we do the same thing using general fund money to subsidize the cancer care? Because, like you said, Terry, there are more and more people coming up with cancer, and it's not something that's going to stop. Now, I know that Senator Sablan said 2.5 would actually put us at that marker. But if you ask me, we have undercutted since 2020, 2021, now 2025. I think we should make it $4 million just to try and catch up, which most likely, we probably can't for all those years that we've been undercutting the Cancer Care Foundation. So I want to thank you, and I want to recognize all of you here today, all those who are here today. Can you please stand up if you are here supporting the Cancer Care Foundation? Can we get everyone to stand, please, who's here for that? And that is telling. Thank you so much for fighting and for being here today to represent those who cannot be here or those who have gone on and passed on. Thank you so much. And I will advocate for $4 million for the Cancer Care Foundation, not $2 million. We're still undercutting ourselves. Shame on us. Shame on us. And I will fight for the hospital too, Ms. Pasadas. So thank you so much, and thank you, Mr. Chair.
Thank you. Madam Speaker, and you'll be followed by Senator Brown.
Sidus Masi, Mr. Chair. So we are in quite a predicament today. Our budget deliberations as to how we were going to spend any excess 24 revenues or excess 25 revenues that we might receive were cut short by a motion. So we were going to do it supplementally, and but as to where the money, it was really actually made in the budget session, the contention that these programs should have been funded from the original source of money, not necessarily from supplemental. Because as you pointed out very accurately, the formula that was supposed to be honored is a certain percentage goes to Guam Cancer Trust Fund, period. And so we question why that did not happen. To me, Healthy Futures Fund's decline doesn't matter because it's a percentage, and even with the decline, the percentage is not being met, right? And I support, of course, the inclusion of the Guam Cancer Trust Fund in here. I think the motion that was made when we put off all the deliberations was to put all of the appropriations that we were considering from FY24 and FY25 appropriations in, but that's not in the bill. So only some of those amendments that we were proposing are in the bill. But so that Guam Cancer Trust Fund percentage was questioned since day one on the budget deliberations. So was the GMH. So we also questioned why the GMH budget did not look anywhere near what GMH had requested. We also asked, it was not in the original budget request from the governor. It was not in the amended bill from the committee, as we saw on the floor. And then the governor's fiscal team also came in on day one, and we asked them, why are you sending, they gave us a letter on day one asking us to increase FY25 appropriations to cover some other departments. And so we have a list of these. But none of this included GMH. So we did ask them, why, if not in your original budget request, not in the amended bill, and not on this additional letter that they sent us on day one of the budget, did you not include any more money for GMH? And I thought the answers from the fiscal team were not very convincing. They didn't seem to be persuaded at the time that GMH needed the money. But there were amendments, even by the appropriations chair, to dedicate additional funding to GMH. I tried to make motions to, we're going to increase the FY25 revenue. That did not pass. So we are here today, and we seem to be pitting GMH versus all these other agencies. But I hope, that cool heads will prevail, and that GMH, that you will be able to convince the senators that, you know, as we talk about the life or death situation with cancer patients, which I totally support, that the rest of the money needs to go to GMH. We still have naysayers in the community who say GMH is paying too high salaries, GMH is doing this wrong, doing that wrong, doing this wrong. But I remember that very clearly in the budget deliberations in our hearing that we had for GMH's budget, it was laid out very clearly that without that amount, that was kind of a minimum amount, and that if we didn't meet that, we would not be providing critical services. And so you have announced recently in the paper, for example, you're cutting off non-emergency surgeries at the hospital, and then you were going to, there was a hiring freeze announced. And is that because of your budget, or is that because of other problems going on at GMH? Yes, please.
What we had disclosed was the very close decision to make was to then suspend elective surgeries at that time. That was about 2 weeks ago, because the vendors that supply us the surgical supplies to do surgeries, we were low in stock. They were not going to give us any more supplies because we owe them. And so that was averted when we spoke with the governor. So she allowed the advance payment from the fiscal year 2025 pharmaceutical fund, $5 million, to then pay those 14 vendors that provide those supplies. And so we averted that decision, thankfully, that we did. So we continue to provide elective surgeries as well as emergency surgeries. In terms of the hiring freeze, that was what we were looking at in order to then live and stay within what was approved for fiscal year 2025. So we looked at all those vacancies, and if we can live without hiring for those vacancies, then I guess we're not going to hire, because we have to stay within that budget that was approved of 37.7. So that was just one of the measures we were looking to see if we can then, you know, make do with the 37.7. We haven't really made the decision to freeze hiring, but that was what we were looking at. Thank you.
Well, the additional $20 million for GMH in the bill that I proposed and in the governor's letter to us on this bill, she's proposing that all the additional revenues go to GMH. Well, 20 million of it now. First she said all, now she's saying 20 million. 20 million doesn't get you up to your budget requests yet. It would be 34 million or something that you need to get up to your budget request. But 20 million, what services would we save by giving you the 20 million?
All the services that we are providing right now, we can continue to provide that. Particularly since we just launched the Angio Suite, we want to make sure that we really fully operate that for people who really need it for their heart, for their neuro, and whatever other procedures and diagnostic treatments that they need. So we will continue to keep that Angio Suite fully functioning. We have a cardiologist who can do all kinds of procedures and treatments for people with cardiology conditions. And so we will continue that 20 million, and thank you so much for that. We will certainly continue. I know it's not going to meet the 74.3, but at least it's more than what we were originally given in terms of 37.7.
Okay,
so
because
thank you for
during
that.
the budget hearing, it was threatened that there was a list of services that would be cut if you did not receive that minimum amount. But you're saying now that with 20, you will be able to continue to provide all your current services.
We certainly can. Yes, ma'am. Thank you.
Sorry, Speaker, if I can just clarify, since I was here for the budget hearing. I think that 20 million will at least get us into that middle category where we're not looking at closing things, but there may be some marginal cuts to things, but we will be able to sustain some of the, I say, the basics, the core functions of GMH with the 20. It gets us a lot closer.
All right, and the money from the governor was not additional 5 million, it was just an advance on what you were going to get under FY25 budget?
Correct, yes.
All right, and so according to the auditor, the GMHA audit is not yet done, and there are a couple audits that are holding up the entire GovGuam audit, including GMH. What is the status of that?
We just finished it.
Okay.
We were waiting for the auditor, Ernst & Young, and so we completed that, and so that has already then been submitted to the OPA.
All right, well, one of our issues here in the legislature is without these audits for the government of Guam being completed by the time we do our budgets, our hands are tied as well. So I'm going to put that on you at GMH. If you know, we have to all do our part for this budgeting, so we need those audits timely. We need them submitted to the auditor so we can get the GovGuam budget out and see what we can really do with any excess revenues that we might have.
We agree, and thank you, Senator. Our hands were tied too, because the contracted vendor that was doing our audit was also delayed in getting it done. So thank you for that, though.
All right, and so, all right, as to the other appropriations in the bill, I know there's only some of them that are represented here today, and we'll hear from them in a little while, but there are some of these that I'm hoping, Mr. Chair, that we can, you know, divert to other places. For example, there's an appropriation in here to pay for the HVAC for the forensics building, to pay for, to give it to GPD. But when I'm reading the statute, that really should be coming out of the Judicial Building Fund, which is, you know, funded by the ticketing by the GPD officers. It goes into Judicial Building Fund. It was dedicated to the forensics facilities, and the loan that the GCC helped them to build. And, but I think also that maintenance can come out of that. I'm hoping, we'll see. But those are the kind of choices that we're going to have to make with this thing is, yeah, what's absolutely critical. We really need the very good information. So thank you, Mr. Chair.
Thank you. Senator Brown, do you have any questions for the panel in reference to their testimony?
Thank you very much, Mr. Chairman, and certainly good morning to all of you that have come and provided your testimony on this supplemental budget. I think the realities of government are very fascinating. We brag that we have a $1.3 billion budget, the largest budget in the history of the government of Guam. In my last legislative life, we used to debate whether we were going to approve $450 million or $500 million for the entire government of Guam. And now we're finding that what we would look at as the most critical needs, I mean, we have a lot of needs. There's a lot of things we want in life, right? But when you look at the most critical needs that you have, how have we prioritized that? Because your needs have not changed much in the 30-plus years since I first came into this hall. Healthcare, education, public safety, 1, 2, and 3. Those have always been the main priorities that the people of Guam have told us is what is most important to them. Everything else after that is what we want. I have to commend my colleague, Senator Tellos, not just because she's my good friend, but she on the floor of the legislature fought vehemently to fund the Cancer Trust Fund. She put the amendment up to ask for the $2 million that was voted down. There were a lot of things put in the Budget Act that most of us, including those that sit on this Budget Committee, had no say in, really, ultimately. They were put in. Who put them in? How they got there? Doesn't necessarily go through the transparency process that we like to brag, that we say so easily. It's, you know, we want to be transparent and accountable. But how things get put together is not always that way, even in this day and age when we would expect that that should be the standard. I know what it's like to take care of a cancer patient who's dying. I'm sure all of us in some way or other, if not ourselves, have had an immediate family member that we have had to care for or deal with the fear, or when you're told, or when that phone call comes, when you get that confirmation of that test result, and your most immediate thought is it's a death sentence. My father suffered from cancer. He survived lung cancer for 18 years, and then it came back ferociously and very quickly. And I took care of him in his final days. I'm grateful that I was there to do that. But I know what it's like. So when we cannot fund the critical things that we need in this government, and we're funding so many other things, because all you got to do is ask. I realized I didn't need to be sitting in this chair to determine what was in the budget. I could be out there and make sure I know my most favorite senator to ask them to put what I wanted in the budget and get it passed. That isn't how the process should be, but here we are. We brag about all our excess revenue, and yet something that we think is as critical as helping our patients with cancer out there was not funded to the level that it needed to be. We also have a situation of what's knocking on our door, because right now this bill is looking at a little over, what, $36 million in excess revenue that is unaudited, which means it may or may not be there. It may or may not be there. We're like operating the blind, trying to make appropriations. In the old days, we used to appropriate money and just, leave it up to the governor, even whether the money was there or not, and we'd blame the governor if something wasn't funded. So we started to require fiscal notes. Hopefully that when we were on the floor of the legislature deliberating a bill, we would know whether the money was there or not. That almost doesn't matter now, because everything's notwithstanding and we just throw it in and maybe it gets covered, maybe it doesn't. It's not responsible budgeting. I'm sure we don't get to do that with our own money. Do we have $20 or $30 to gas the car? Right? How much money do I need today so I can buy my lunch too? Do I go through the drive-thru, or can I actually sit in a restaurant and have a decent meal? We all make those budgeting decisions, and we should be just as responsible at our level. Because I'm very concerned moving forward. We are what? What is today? October 3rd. We are 3 days into the new fiscal year, and we are already looking at a supplemental budget 3 days into the fiscal year. Do you know historically when we used to look at supplemental budgets? Halfway through the fiscal year in about 6 months. So I don't know if the presentation's being made that we are doing so well and we have so much excess revenue and money's falling from the sky is really what's going on, because we're here fighting for at least $2 million at a minimum for cancer care. I'm just bringing this up because I think all of us just need to be mindful of what really is going on and whether or not the money that is being generated by this government is going to what you really think is a priority. But I appreciate all of you that are here today to relay what you believe is a priority. But this was unnecessary because the efforts of Senator Tello were voted down on the floor. Last year, she went there to make sure she got money to cancer care. She was, I'm going to be that meeting. I'm going to be that meeting. I'm going to make sure they fund this. If we do not have enough money at this point to cover the demands or the needs of the Department of Education, I was just talking to our education chair here, they're looking at $47 million that they need to make it through this 3 days into the fiscal year. If we're looking at the hospital that at least says we can try and survive with $20 million, well, that's $67 million. And all we have on the table is maybe $36 million. So I guess we have some work to do. I guess we have some pencils to sharpen, because I'm certainly going to be there, as I'm sure when the time comes, to advocate for what is most critical, for what we really need versus what we really want. So I don't have a question, Mr. Chair, because I think everyone that's come here this morning has articulated quite well on the panel what they support. But I think the challenge is for us is to be really upfront with the public in terms of what we're appropriating money to and what is the most critical. Cancer care, I think we can say very much is a priority, but I think also addressing the needs for the Department of Education and also what is needed by the hospital to get through this fiscal year so that they can ensure that they can provide the most basic services that our people need, particularly those that don't have the opportunity to be able to afford care outside of any other institution on Guam. So I did want to relay that. And I think that's a challenge when we deliberate this bill and look at what the priorities are, because we didn't make these, most of us, well, at least these people on this side of the table here, we didn't have any input into the supplemental budget. What do you think? Do you think the people on this side of the aisle, do you think we voted for that $1.3 billion budget? Anyway, Mr. Chair, thank you for the opportunity to comment, and thank you to all of you for taking the time to come down here and letting us know your priorities.
Senator Barnett, do you have any question for the panel in reference to their testimony?
Mr. Chair, and Undunkaluna to the panel, and really for this community to come out and, in this show of force, provide testimony on the record to ensure that we address what really and frankly should have been addressed across the hall during the budget session. And I'm sorry for the anxiety and the frustration and the uncertainty that's been caused by the recklessness of the way we proceeded in that budget session. I voted no on the budget. I voted no because it shortchanged cancer patients. I voted no because it shortchanged the hospital and it shortchanged public education. And we had $27 million in excess revenues on the table when we were debating the budget, and we could have easily addressed many of these areas across the hall over a month ago. So, and as Senator Brown said, we usually do the supplemental budgeting later on in the fiscal year, so I don't know if this is an attempt to make you guys come and jump through these hoops so that you can say, oh, thank you, senators, for giving us that money for the cancer patients. And if that's the case, it's just frankly disrespectful. But I do want to commend everybody who receives funds from the Guam Cancer Trust Fund, because like Senator Brown said, I think many of us up here and in the community have been on the receiving end of the great assistance that many of you provide at a time in people's lives when they're facing death, quite frankly. You know, my mom's sister, Auntie Jeannie, we went to Guam Cancer Care, we went to the Edward M. Calvo Cancer Foundation, and that's what our people do in between having these fundraisers because they can't afford the care here on island. So they have these fundraisers, and you know, it costs a lot of money to put on a fundraiser. And so that's what they do. They have the fundraisers, then they do the rounds. You know, you can get certain things from Guam Cancer Care. You can get the financial grant from Edward M. Calvo Foundation, and it's just unfortunate that so many of our cancer patients look for these opportunities. It's one of the first things they do when they get their diagnosis. I mean, we did that from Auntie Jeannie. Called around, okay, what's available? What can we get? Transportation to appointments. Financial grant of $500, which in those times is so very critical. And it's just unfortunate that we're going through this, and I think it's a dog and pony show. We could have easily addressed all of these issues across the hall. And, you know, there's already enough trepidation because of the declining Healthy Futures Fund revenues as we see more people migrating to vape. And we passed a vape tax, or I think we're about to vote on a vape tax. I attempted to amend that to direct more funds to the Healthy Futures Fund to address those shortages. Unfortunately, that didn't pass. So we're working. When we didn't fund the Guam Cancer Trust Fund by $2 million in the budget session, and we were still in the session, I introduced a bill to appropriate $2 million to you guys. So I'm grateful that the Appropriations Chair included that in this supplemental budget bill. But again, I feel that it's something that should have been done across the hall. But unfortunately, when that budget passed, we had colleagues giving themselves a round of applause because they chose to prioritize the racetrack over cancer patients. You talk about, you know, prioritizing life and death matters, and it was just embarrassing. So thank you again for your testimony and for having the courage to come out and really speak truth to my colleagues here about the importance of funding the Guam Cancer Trust Fund like we're supposed to. Thank you, Mr. Chair.
Thank you, Senator Barnett. Senator Fisher, do you have any questions? Then we'll move to Senator Duenas, then Senator Canata.
Yes, thank you very much, sir. I appreciate the opportunity, and thank all of you for coming out to testify. I've got this first question is actually to the Guam Cancer Care Trust. Sir, you are structured as a trust? Can anybody answer? Yeah.
Hi, thank you, Senator, for that question. The Guam Cancer Trust Fund is technically a trust. It's the University of Guam receives the appropriations from the Department of Administration, and we kind of serve almost like a pass-through, but we do take care of the fund. It's in a separate account. We keep track of those monies separate and apart from the University of Guam, although we have University of Guam staff supporting all the administrative efforts.
Okay, but you are actually formed as a trust, correct? Or
the public law that sets up the fund itself is what lays out, if I'm not mistaken, the rules and regs of the fund. And so the trust, I guess, the trust aspect of it is that it is a separate account, separate and apart from any other operation.
Okay, the reason I'm asking that question is because, you know, theoretically, if you have a trust, then you live off the investment and you keep the thing, right? So I'm wondering, Do you have any idea how much money is in the trust right now?
Right now, I believe, so as we receive the funds, so the Department of Administration provides us a weekly allotment, and that gets put into the fund, and it becomes part of our investment portfolio. And so we do earn some types of interest, but all of that still gets dispersed out. So when I looked at the August 31st financials, I believe if we include all the encumbrances, the balance itself is already in a negative because all the applications that come through, encumbrances, okay, so not expenditures. Expenditure-wise, the balance as of August 31st was about $1 million. So as funds come through, we disperse it out. It's basically just in and out that way.
Okay, so you're not actually accumulating the money and investing it for interest?
What gets accumulated or what gets in, I guess because the grant application process happens throughout the year, the funds are received and put into the trust waiting for the funds to get dispersed. Okay. So it's not in our fund for a long period of time, but whatever interest gets earned in that prospective period gets put into the disbursements as well. So
okay,
there is some interest.
Are you actually dispersing the trust itself? Or are you holding on that for investment purposes?
So there is some for investment purposes. I'd have to probably get you the balance. But as far as what I'm looking on at our financial report as of August 31st, we've dispersed all the funds, and it just continues to roll over into the next fiscal year, and there really isn't much because the applications have grown over time.
Okay. Well, let me preface this next question by saying I support what you do.
Thank you.
Of course. I mean, who doesn't, right? Does the trust, have you been subject to audits?
Yes, we have. And so because we do, the University of Guam receives the funds, the Guam Cancer Trust Fund basically becomes part of the University of Guam's audit. We report out all the fiscal activity that happens through the fund.
So if we were looking to kind of do a forensic examination of what you folks have been up to, we would look at the audit report for the University of Guam?
Yes, that's correct. And we also issue, we publish the monthly financial reports of the fund on our website as well.
Okay. And let me just stay in the weeds for a minute on this one, okay? Do you have trustees that are appointed to the Guam Cancer Care Trust?
So from what I understand, we have a council that reviews all of the applications that get dispersed or that get approved and dispersed through the year. And then, we obviously have a governance structure at the University of Guam. So if there are any funds that are put into the trust and put into investment accounts or things of that nature, that is overseen by our Board of Regents.
Okay. All right. Thank you.
You're welcome.
I think it was Senator Espaldon, thank you. Senator, I believe it was you who said that, well, let me come back to that, okay? This discussion, well, you were talking about the Healthy Futures Fund and the fact that the funding has dropped for Guam Cancer Care Trust because of the decrease in contributions contributions to the Healthy Futures Fund. We've had this discussion before, and I'm sure you can appreciate the irony here. We like to see the Healthy Futures Fund drop, right? Because that means less people are committing these things that generate the money. But the dilemma is, as the Healthy Futures Fund drops, so does the money that is going out to Guam Cancer Care Trust. Is that true? Do you have any comments on that?
The comment is I agree with you, that concept, that it's a good thing that we're seeing a drop in the Healthy Futures Fund because it does send a signal that perhaps smoking is down, drinking is down, and whatnot. However, we need to also take a look at the economy as a whole in terms of the tourism industry. We're not where we were before, so I think that a lot of those, and excuse me if I use the expression, the syntaxes, right, again, has decreased because of the economic hit.
You know, I didn't even consider that. A lot of the Healthy Futures Fund is generated by tourism. Tourists will buy a bottle of liquor, they'll buy a carton of smokes, whatever, right?
That's right.
Okay, and so when tourism drops, the Healthy Future Fund takes a hit as well.
I would imagine so.
Okay.
And again, in spite of it all, I mean, even if we go down this road and we see declining revenues into the Healthy Futures Fund, again, that might signal the case that there's the potential of a decrease in cancer incidences because of the, you know, the adverse effects associated with the substances that are bought that contribute to the Healthy Futures Fund.
Well, I guess everybody's goal fundamentally is for the Guam Cancer Care Trust to go out of business because it's unnecessary, right?
The answer is yes, but I'm not sure that's even a possibility. And the reason why I'm going to say that is because one of the things that I was thinking about introducing into this discussion was, why is there so much cancer on this island? And we can point to a lot of different things, right? We can point to maybe the military presence on the island and what has occurred in the past, and when we start talking about Agent Orange and perhaps other toxic chemicals that have been displayed on this island.
Diet.
Right? And I know that Agent Orange was not the only toxic agent that was used by the military. In fact, when I was chairman of the Military Affairs back in the day committee, right, I knew that there was a whole spectrum of colors of agents. There was Agent Purple, Agent White, Agent Green, Agent whatever, right? On top of it, there have also been some practices by our own government in the past that I had personally witnessed, where in the past where we actually would take transformers off the electrical poles that were no longer working, and we'd take those PCBs and those transformers and pour it on the dusty roads and the coral-capped roads just so that we can keep the dust down. Again, not knowing the dangers.
Are there also, in addition to those kind of fundamental environmental issues, I think you would agree that there are issues of diet, lifestyle? Oh,
definitely. Diet, lifestyle, and again, when we start talking to the substances that we use and abuse, right, cigarettes, et cetera, yes. So, again, and then I just don't know, because like I said earlier, there are so many different kinds of cancers and some very rare cancers that I'm seeing, at least from the patients that we assist, right? Where those come from, I don't know. We don't know.
Yeah.
And so I'm not sure that even with the decrease, I mean, that we can actually correlate the decrease in the Guam Cancer Trust Fund or the Healthy Futures Fund money that will go to the Guam Cancer Trust Fund, that actually cancer will be eliminated, because there are other external factors, I think, that afflict our patients.
Thank you very much, Senator. I just had a couple more questions, and I'm sorry, the lady who spoke about GovGuam's insurance and formulary, and I beg your pardon, ma'am. Eva, Miss Eva, first name, last name? That's Eva, first name. Ugen? Eva Ugen?
Yes, sir.
Okay. Good morning, Miss Ugen.
Good morning.
You said something that I thought, there's the amount of uninsured people on Guam is scandalous. There's nothing we can do about it yet unless we come up with a program to help these people. We've got, you know, thank God, we've got Medicare, Medicaid, MIP, and we've got private insurers, and we've got GovGuam insurance, but it doesn't nearly cover the entire population of Guam. The reason I said that is because I just wanted to say that many times when people get a cancer diagnosis and they can't afford it, they will have fundraisers. They will send, sell tickets and so forth to make some money. But I was speaking to a person in the insurance industry, and they said many times these people do not have fundraisers. They simply go home to die because it's their time. That's what they think. They simply go home to die. There's a scandal for you. Ma'am, I wanted to ask you about the formulary. I don't know if you can answer this, but there are clearly some treatments which are not, as you stated, are not covered in the formulary. For example, I don't know that immunotherapy, which, happy birthday, President Carter. I mean, he's still with us because of immunotherapy. I don't know if GovGuam covers that. I don't know if they do, they don't, if they're covering, you know, the war on cancer has been going on forever. My question, I guess, to you, ma'am, is this. Do you know of a way that we have GovGuam insurance that a person could purchase a cancer rider that would expand the formulary? I don't know, but.
Unfortunately, I'm probably not the best person to answer that question. That would have to be your TPA. I don't work for them.
Yeah.
I can only tell you my experience as a healthcare provider and the applications that we've seen over the last, I want to say from February of 2024, that what drugs that historically were covered by your plans with $100 copays are now being rejected at 50% coverage, not applying to your out-of-pocket maximums. And so a lot of the applications that Ellie and George and I work on a daily basis, it's no longer the MIP, Medicaid, Medicare patients. It's the GovGuam employee as well that we're seeing an influx that we're having to fight to help. And these are people who are working. These are people who have worked their whole lives. And I can't speak to the decisions that the government of Guam health plan has decided and the formulary that they've chosen to adopt, but it is public information that you can get on their website. The formulary is published. I can only tell you that based on information that DOA has published on their website and your schedule of benefits, it says one thing, but that's not how the benefit is being applied. And we've heard explanations from different people with different answers, neither here nor there. At the end of the day, these government of Guam employees, and not just them, but they're the ones being told 50% not applicable to an out-of-pocket max. These are the ones that just in the last 3 days alone, I've had to put in 8 applications for prior authorizations for. These are the ones who are saying, what am I supposed to do? And we said, we fought with your insurance. We've escalated it to DOA. We've done this and that. But we can only ask that with Guam Cancer Care that they can at least get $20,000 of coverage.
Yeah.
So it wouldn't be fair for me to answer on their behalf. I can only tell you what I've experienced in the clinics. But the people who are going to need the support, not just those who are uninsured or not employed, these are you. This is your families. This is your beneficiaries. And these are the ones that for the last, we're only in October, for the last 8 months that we've been fighting and appealing and saying, hey, if it were somebody else, you would have applied a $100 benefit, but right now you're saying 50% and it doesn't apply to a catastrophic coverage level, and this is not fair to anybody. But that's the kind of services and the relief and the help that these kind of organizations assist with.
Thank you, ma'am. You and I have both been using the word formulary. I understand that formulary is essentially just a list of drugs or treatment that an insurer will cover. And if it's not in the formulary, they're not going to cover it.
And that may or may not necessarily be true, and it may be a matter of benefit interpretation. Not all formularies are closed formularies, where if it's not explicitly stated, therefore it is not covered. I have reviewed the formulary. These drugs are not on the exclusions list either. In fact, we do see some of these drugs on the formulary that says specialty and then non-formulary but PA. But the way the schedule of benefits reads is that it does allow for specialty and it does allow for non-formulary drugs. So I think it's more of a matter of benefit interpretation. And I may be overstepping to some degree when I say, and I'm looking to Ellie because we're trying to be very diplomatic in the way that we share this information, because we're not trying to bamboozle anybody. But if you take the judiciary of Guam's plan, where they they are government of Guam employees, and they are with one organization, and they are also insured with another organization. When we look at the same drugs and one signed up for this plan, it's covered $100 and it applies to out-of-pocket max. But for the member right next to him who works for the same judiciary organization, we're gonna get a denial that says 50% not applicable to out-of-pocket max. So I don't think it becomes a matter of benefit interpretation more than anything. And
can Guam Cancer Care advocate for those people who are going through the nightmare of dealing with an insurance company?
we have, they have. We've been fighting this for months.
Yeah.
To the point where we've gone to these patients and said, look, here's your labs, here's your progress notes, here's what your insurance has said, here's your emails. Go to the governor's office at this point.
Yeah.
Because they're saying it's DOA, they're saying it's the TPA, they're saying, so.
Yes, ma'am. I guess I'll just finish with a comment. You know, when a person, a mother, has to choose between buying or purchasing a drug that will save her life, and then having to mortgage her home so her children upon her death do not have a place to live, I mean, the mother is going to almost certainly opt for protecting her family. It's just a heartbreaking decision. It's a heartbreaking dilemma. I think it is that we have a system that puts somebody in the choice of I must die to save my children, when we could easily have a different outcome. I think that is, it approaches a moral question to me. So,
absolutely.
thank you very much. I appreciate all of your testimony. Thank you.
Thank you.
Thank you, Senator Fisher. Senator Duenes?
This is Masi, Mr. Chairman, and I also want to thank everyone for being here. I know this obviously is a very special moment for you to represent what's before you and what's before us. I think also it's very important to understand how we got here. There's been different representations, and I want to make it clear. Terry, first of all, welcome, and to everyone. I have a couple of people I consider friends in this hall, Senator Espadon and Senator Rodriguez. I was there in the 31st Guam legislature when that legislation was rushed to Governor Quambo for signature. So I remember all the efforts put forward. We are here today because the greatest sin that happened in the budget process was in the miscellaneous provision. There was $120 million of appropriations competing for $27 million unaudited excess revenue. Senator Espadon and Senator Rodriguez can certainly probably understand why the majority of the body said stop. Because many of us here today are talking about pitting competing organizations against one another. I cannot think of anything more than the highest level of pitting organizations against each other. It would be so irresponsible to have passed that budget with $120 million competing for $27 million. You can imagine the myriad of organizations coming forward when they weren't funded by the governor's office saying, what's going on? Well, what's going on is you have $120 million of appropriation with $27 million possibly available, so I can't possibly write checks to every single one of you. So that decision now becomes the ultimate of political decisions, because everybody can run around saying the senators didn't give us the money. And we say, oh, yes, we did. Right there. It's in the budget. And the governor said, what a joke. You gave me $120 million worth for programs when you know already that I only have $27 million possibly available. Now, I say that because I'm a co-sponsor of this bill, because what I wanted to do was to make sure that we refocused and that we had at least a targeted set of programs to come back across the hall and sit down and do something responsible. And that is to re-debate this budget based on figures and numbers when the fiscal year has started. And I will absolutely advocate, no question about it. Senator Espadon, I thank you. Senator Espadon, you guys parked himself down here for days saying what happened not only, but I said, we have it in the miscellaneous provisions. only to find out later on that the miscellaneous provisions were just voluminous and out of control. So here we now have a bill before us. I'm sorry to have to do Budget 101, but I think it's important so you don't walk away from here thinking that some senators want to do this and some senators want to do that. Most senators who want to debate a budget want to debate a budget that actually talks about true numbers and money that's available. That's what this bill will do. This bill is also an omnibus bill. It's a multi-subject bill, which means it's basically revisiting the budget. So, Lillian, I support the hospital as well. I support the things that are being said in the public, even by the governor, that she wants the entire balance of the prior fiscal year going to the hospital. What does that do to us now, right? Now we're back here. The beauty of this, folks, is we get to bring down Office of Finance and Budget. We get to bring down BBMR and do this all over again. And we'll do this based on the fact that there is another 2 financial reports showing the stability of the funds coming into the government and what would be tracking going even to fiscal year 25. You know, many appropriations were even attempted to raise the fiscal year 25 appropriations. That would be on the table. The reason why is we would have at least one report that says how it's tracking and what 25 is going to look like. Like I said, I know it's probably boring and numbers is not something that is sexy, but the truth is I say this to say this. This is the right way to debate priorities. The wrong way to debate priorities and the wrong way to pass a budget that's so-called priority is to throw everything in there and then just let everybody fight for it. So with the hospital, with the Cancer Trust Fund, which is covered here, maybe raising the appropriation, that's all game on the floor. And whatever is debated within this budget proposal as a supplemental can entertain any other bill that's been introduced because it's an omnibus budget act, basically. And so I look forward to seeing all of you when hopefully this bill hits the floor soon so that we can make sure, first and foremost, those that are here and made their presentation, that the budget is there for you, because I will be voting for that, in favor of it. And then we'll have all the other competing interests that we'll be entertaining when we come down. So I just hope you understand that it's really, I've watched you, Senator Espadon, before, how you fought on the floor. And you were a stickler when it came to numbers as well and budgets. And, you know, you didn't want to make promises that you couldn't keep. That's what hopefully we won't do when we go in and do this supplemental budget. We will identify the Cancer Trust Fund as a priority. We will identify the hospital as a priority. And we will ask the governor's office once again to meet us there, because they will be here. They will be here to entertain it. They will be here so that when we walk out of the room, instead of handing the governor an omnibus appropriation that's way out of whack, it will be something that both the legislature and the governor said, we agree, and we'll fund it. With that, Mr. Chairman, thank you for the opportunity to present to the folks the reason why we should do things responsibly. One more thing before I close, and this is something we have to discuss with the governor's office again. The Cancer Trust Fund is a special fund, just like the Tourist Attraction Fund is a special fund, just like we have, I think, 15 different special funds. Guess what the governor's office has told us every single time they've come down to the legislature when you talk about budget or any appropriations measure? We have covered every shortfall in a fund with the general fund appropriation. That means every fund that has been tracking below what its anticipated revenue was paid for even without an appropriation. Even if you didn't pass a bill that had the full appropriation for that fund, I got the Department of Administration director on the record saying that they cut those checks. Regardless if it's $1 million, regardless if it's $5 million, every single fund that does not track what its level is or what the level is for the entire fund is subsidized by the general fund. So there's really, I want to say this because I want to pass this bill and I want to make sure the proper appropriations get made. But I hope we can also understand that there's really no major reason for alarm when we know that a governor's office is capable of doing this. I think it's more about us advocating and making sure that we say, hey, if you can subsidize the Tourist Attraction Fund, you can write a check to the Cancer Trust Fund. And we can do that in the interim before we pass this budget, and it should be a continuum. There shouldn't be any stoppage of funds going to make sure that we can continue to fund every single request that's been put forward as per the budget and as per what's tracked to the special fund. So with that, Mr. Chairman, thank you very much. I look forward to hearing the rest of the testimony where the folks have come out. Thank you, and God bless you.
Thank you, Senator Duenas. Senator Canata, do you have any questions for the panel?
I don't want to delay anyone further, so I just wanted to thank each and every one of you for coming out today. Senyor, se Deus masi para ifinaturmito, para izomu cuentos pago in hingo clouds and dipotsi puna entertaining estina proponents that sempre mapasa estina le proponents and manai gobetno lo. In essence, I just want to thank each and every one of you for taking some time out of your busy schedules and for being here present today. I certainly applaud all of your testimony, and I look forward to the passage of this proposed bill, and hopefully we can resolve some of the appropriations and help you guys move forward with the projects and agendas. So thank you again for coming out today.
Thank you, panel, for being here. And you're now excused, so I can call up the next group. And just a reminder, like I said earlier, the supplemental budget is here, and it can change. It can change. Trust me, it can change. There's no holds bar. On the next group panel, I will start with the folks that were called earlier, but they weren't here. We have Senator Rodriguez. Are you going to testify, sir? Please come up. Is there a Dolores Lee here also? Dr. Lee, where are you at?
She's right over there.
In red?
No, in the black.
In the black. Oh, right there. Oh, okay. Yeah. Please have a seat. Okay. And let me call the rest. We have Jennifer Calvo. Is Jennifer Calvo here? Please come up. We have Samir from FHP. Come on up. We have Jane Flores. Ms. Jane Flores, come on up, please.
Jordan already gave.
Yep.
We already gave. Dennis is here.
Then we have Dr. Carter, please come up. And we have Agnes White. Agnes White, please come up. We have Anna Lisa, cancer survivor. Is Anna Lisa Ganello? Are you here? Are you Anna? No? Are you Anna? No, you're not. Okay. Okay, and we have now Sharon Omelon. Sharon Omelon and Eric Swanson. Dr. Swanson, where's he at? He left? We'll call him in. That should fill everybody. Dr. Carter, you coming up? Or we're going to get a chair. Or put Dr. Swanson anything on the other end when he shows up. Okay, when we begin, we're going to start with the folks that I called out first. Thank you, Senator Rodriguez, for coming here. We'll start with Senator Rodriguez and then followed by Dr. Lee. Then if I'm correct, I called up Jennifer Quambo. Am I correct? Okay. I'm just trying to make sure everybody's sitting in the order I called, okay? Then we have Samir. Samir, is that correct? Okay. Let me know if I'm murdering your name, okay? Don't just go like this because, all right, thank you. Then we got Jane Flores. Jordan is gone. Mr. and Ms. Rodriguez, is Dina going to testify also, Senator? No, no, just you, okay. You're already here, Dr. Lee. And then, I think we got Dr. Okada here, right? Ma'am, your name is? Agnes White. Okay, Agnes White. Then Dr. Okada. Then Sharon Omelon, you're here. And then Eric Swanson. Dr. Eric Swanson. Okay, so be mindful in the direction we're going. Senator, you be first, and then then we're going to go that way. To my left, your right. Okay, and then we'll work our way back. And we'll start with you, and then Dr. Swanson. Dr. Swanson will be the last. Okay? All right. Make sure whoever needs to be here is here. Okay. Now we'll begin with you. Sir, Senator Rodriguez, please.
Hafaday, good morning, Mr. Chairman. Good morning to Speaker and to the other senators who are here. It's so good to be back here. Just a little difference, sitting down here and doing this testimony, but thank you very much for this opportunity. Of course, my name is Dennis Rodriguez Jr. I'm testifying on behalf of the Total Guam Foundation. We are a 501c3 nonprofit organization established about 7 years ago, and our main purpose really is to provide, services to our people in healthcare, education, and other support services. And for the past few years, we've highlighted one of our programs, which is our mobile care clinic, which goes out to the community and provide services, healthcare services out in the community, especially for those who are underserved, who don't have insurance, or those who are on public assistance programs. And so we are a beneficiary of the Guam Cancer Trust Fund. This is our second year. Dr. Lee is going to be providing her testimony. She is our clinical director. But all the I think the statements and what was said earlier by the previous panel, we definitely support. I was in the legislature when we had to deal with similar issues like this in ensuring we fund programs, especially as it relates to healthcare. One thing that I like to just leave here is that our foundation and what we stand for and really what we believe is early detection, prevention is the best solution. And you heard from our other sister organizations who are here, who also are recipients of the Guam Cancer Trust Fund. They do great work in providing support services and navigation services. Our program, which Dr. Lee will discuss more in detail, really is a cancer screening program. From the creation of the Guam Cancer Trust Fund back in 2010, it was to, as was spoken about earlier, was to discourage smoking, and I think it's done that. It's done its job, and it was also to ensure that we create programs that would promote screening, cancer screening, and treatment, and of course the other services. And so when we came in about 2 years ago, we're in our second year now, was to really look at how we could increase women's health care, how we can increase screening for cervical cancer. And so from the first year, we've done over 1,000 pap smears, and I know Doc would probably, she's more of an expert to be able to share that. But I think one of the biggest things we were able to do with the support of the Guam Cancer Trust Fund was to bring in gynecologists. And so we were able to do that by the support of the funding that we received. And so these are for patients that would have, maybe in the past, have received abnormal pap smears and didn't have a specialist to go to, right? And so we finally were able to provide that service to our community. We've gone through several locums who were gynecologists. Now we have our own who is now, she's from Guam, Dr. Sylvia Cruz, and so she is practicing, and she's a permanent physician in our practice. But we really hate to see, you know, I know we talk about if the Guam Cancer Trust Fund is not funded properly, organizations like us, who we've submitted our proposals for the new fiscal year, may not be getting that support, you know, moving forward. And it's really, it's going to be very difficult. It's a big setback in our efforts to ensure that, especially those that don't have access to health insurance, who don't even qualify for Medicaid or MIP for whatever reason, won't have that access. It's going to be a very, very difficult thing to be able to live with. But I know you have a tough job before you in ensuring that you find these resources and be able to fund all these competing programs that really all have merit, and that really one way or the other should move forward. But so, you know, I'll leave that and just ask you again to support the Guam Cancer Trust Fund. You know, we are a recipient like the others who have to go before a process and be able to present our program and convince the council that this is something that is needed and something that we can do. And so we're hoping that you continue the support of the Guam Cancer Trust Fund. So it's a tus masi. Thank you, Mr. Chairman.
Thank you, Senator Rodriguez. But you know, you can work your way back to the legislature and be on this side. You know, there's nothing holding you back. Dr. Lee.
Buenas, San Hafide. You know, thank you, Chair, Senator San Agustin, Speaker Terlahi, Senator Barnett, Senator Fisher, Dueñas, and Kanata. Thank you so much for this opportunity to speak in support of this bill, particularly for the funding for the Guam Cancer Trust Fund. As was stated, I'm Dolores Lee. I'm a physician and the clinical director for Total Guam Foundation. We are a local and nationally recognized nonprofit organization that provides medical services and support to the underserved, specifically the underinsured and the uninsured. Total Guam Foundation, through the support of Guam Cancer Trust Fund, established the ENUMERATED para Ifamalawan program, which provides HPV vaccinations and cervical cancer screening and follow-up care. Through this program, Total Guam has provided these essential services to almost 2,000 patients in the 2 years that this program has been in existence. Why is HPV vaccination and cervical cancer screening and follow-up care so important? Cervical cancer is the 4th most common cancer in females worldwide, and the majority of cases, about 84%, are from resource-limited regions. Cervical cancer is the 2nd most common type of cancer and the 3rd most common cause of cancer deaths in resource-limited countries. Why such a disparity? Because incidence and mortality rates depend on the presence of programs for prevention, screening, diagnosis, and treatment of cervical precancer and cancer. Cervical cancer is highly preventable and curable if caught early. I'm going to say that again. Cervical cancer is highly preventable and curable if caught early. Nearly all cervical cancers could be prevented by HPV vaccination, routine cervical cancer screening, and appropriate follow-up treatment when needed. And these prevention services are exactly what Total Guam has been able to provide for Guam's underserved through the support from the Guam Cancer Trust Fund for the past 2 years. As a provider of these services, please allow me to share with you the impact of the ENUMERATED para Ifamalawan program. Since we started providing cervical cancer screening services over a year ago, we have seen an unusually high number of abnormal results. Compared to my private practice, where I care for insured patients who have regular access to medical care, the abnormal rate at Total Guam is about 4 times higher. And the majority of these cases are women who have a history of abnormal results and who know they need follow-up care, but they could not receive care because of a loss of or lack of insurance. But through the ENUMERATED para Ifamalawan program, a program supported by the Guam Cancer Trust Fund, these uninsured women are able to receive the follow-up care necessary to prevent progression to cervical cancer. I cannot stress the importance of access to care and being able to continue to receive follow-up care. This is how we prevent cancer and we keep Guam healthy. I humbly ask for your support of the additional funds to the Guam Cancer Trust Fund so that programs like ENUMERATED can continue to provide essential preventive and follow-up care to the underserved. In doing so, you will allow the underserved, the most vulnerable in our community, to seek the care they need and allow Guam to be successful in eliminating cervical cancer and winning the fight against cancer. Sizos Masi.
Thank you, Dr. Lee. Ms. Jennifer Calvo, I think you're next, right? Yes, ma'am.
Sorry, my first time here. Good morning, Chairman and Senators. Thank you very much for this opportunity. We did submit a written testimony, so I just wanted to supplement that. My name is Jennifer Calvo, President of the Edward M. Calvo Cancer Foundation. The foundation is a Guam tax-exempt 501c3 nonprofit corporation that has provided support services to cancer patients in our community for 20 years. My family formed the foundation in 2004 after my grandfather, Edward M. Calvo, passed away from cancer. Our mission was simple: to honor his legacy of generosity and his immense love for Guam by providing financial support to individuals in our community who are diagnosed with cancer. From our inception until 2012, we relied solely on private fundraisers such as 5Ks, galas, and other events to sustain our mission. We're a small group. We have one employee, and we're otherwise operated solely by volunteers, which are aunties, uncles, cousins, and just basically my family. In 2013, we applied for our first grant from the Guam Cancer Trust Fund. We have been blessed, and we are very grateful to have received the continuous support of the Guam Cancer Trust Fund Council for over 10 years. The Guam Cancer Trust Fund has enabled the foundation to expand its services to local cancer patients by simultaneously increasing the number of patients we help annually and also increasing the amount of the assistance provided to each patient. Over the past 5 years, for reference, the foundation has helped an average of at least 500 patients per year, which equates to at least $500,000 in direct support services for medical treatment, appointments, labs, imaging, medication, and other components of care. Last year, this number actually increased to over 600 patients and more than $600,000. As you are aware from all of the testimony provided so far this morning, the foundation is one of several nonprofit organizations that support our local cancer community with the help of the Guam Cancer Trust Fund. The additional funding proposed in Bill 355-37 is critical to ensuring the continuation of essential services to Guam's cancer patients through the comprehensive administration and management of the Guam Cancer Trust Fund Council, which selects the recipients of these funds and oversees and enforces their compliance with statutory mandates for the use of these funds. I have submitted written testimony detailing the history of the Foundation's Patient Services Program, the expansion of services funded by the Guam Cancer Trust Fund, the uses of funds by cancer patients, and the number of patients that apply for financial assistance for consecutive years because of the duration of their treatment. For example, approximately half of the applications received annually by the Foundation are for first-time applicants. The other half are applying for consecutive financial assistance for their second, third, fourth, fifth years, and up to 11, 12, and even 15th years. The written testimony highlights the undeniable need for access to essential care that is secured with funds annually appropriated by the legislature for the Guam Cancer Trust Fund. Of equal importance, my written testimony also includes several letters and messages received by the Foundation. This provides a patient's perspective and emphasizes the demonstrable value and the beneficial impact that the Guam Cancer Trust Fund has on the lives of local cancer patients. In light of the foregoing, I express my support for Bill 355-37 on behalf of the Edward M. Calvo Cancer Foundation and on behalf of all the cancer patients in our local community that rely on the direct services funded by the Guam Cancer Trust Fund while they bravely navigate their respective cancer journeys. Some of my grandfather's final words that we have adopted as the Foundation's slogan also reflect our mission and the unique support of our island community, including the Guam Cancer Trust Fund Council and all of you that are here today. Simply put, as he said, Guam is good. Sizos Masi.
Thank you, Ms. Kau. It's Dr. Aberley, right?
Yes, Samir Amali.
All right, okay, sir.
Thank you, Senators. My name is Samir Amali. I'm a medical oncologist and hematologist. I practice at the FHP Health Center in Tamuning. I'm also a clinical faculty with the University of Hawaii Cancer Center and an adjunct faculty with the University of Guam. I've been working in Guam for the last 8 years, and I've seen the evolution of cancer treatments and seen many patients go through cancer treatments, recovery, survivorship. We are very fortunate to have a lot of community partners that are present here today. The Guam Cancer Care, the Calvo Foundation, Judah Foundation, the American Cancer Society, the Guam Circle of Care, which is a new support group, Todo Guam Foundation. Now all these organizations, they work to complement each other. We believe in collaboration and not competition. The Guam Cancer Trust Fund has been written in a way that allows for multiple organizations to apply for grants and seek these funds for direct patient care. And I was also a beneficiary of a small fund back in 2018 when we were part of the University of Guam and Hawaii collaboration, and we started the first clinical trial program in Guam. That is still going on, and that was the first seed was actually given by the Guam Cancer Trust Fund. Now, in terms of the treatment of cancer in Guam, if, I can give you a little bit of a background. There are, I believe, 3 medical oncologists in Guam, and which are specialists who treat cancer with chemo medications, tablets, pills, immunotherapy. And there are 2 radiation oncology units, one at GRMC and the other one is Island Cancer Center. So we also see that some of these physicians and providers are locums, and they come in and they go and we get a replacement. So a lot of times if there is one oncologist less, we can probably share the burden. But if any of these organizations lose their funding, there is no alternative. If American Cancer Society does not get their funding for gas cards, there won't be gas cards. If Todo Foundation doesn't get their funding, there might not be a gynecologist they can support. And in the recent last year or so, we've been very fortunate that they have had their gynecologists come and see patients, because we have a lot of underinsured and uninsured population women that cannot find a gynecologist. And we've all heard about the OBGYN situation in the last few years. We've had a couple of providers leave Island this year. So the situation is gonna get worse. So if you can understand, all of these organizations are a spoke in a hub of a wheel. If one of them goes down, there is a likelihood that the other ones cannot take up for the other services. So there is a real need to make sure we fund them appropriately. Now, as I talked about the clinical trial program, we applied for a small grant for educational purpose, and we got the seed money, and that's where we started the clinical trials program. So this is a nationally approved clinical trials that were brought with collaboration with the University of Hawaii Cancer Center. After that grant, we actually got an award from the NCI, and that has been going on since the last 7 years. And we are the principal investigator at FHP. Now, I've heard about Senator Taylor talk about we not only need to give them $2 million, we actually need to go ahead and beyond of that. The reason being, since last 14 years since the GCTF has been in existence, we have seen multiple organizations raise their hands and say, okay, this is a gap in service in cancer care, and we need to plug this gap. And we've seen multiple organizations start and succeed. And there is a lot of scope for other organizations and other services from these organizations to help our patients. So I think the amount of 15% probably is not going to be enough because the smoking rates have been going down. I think we should look at a specific number and make sure the GCTF, the board has the opportunity to present its budget, say, okay, we had this budget, I think we're going to need more budget next time, so add a little bit of increment to the budget every year so that we can continue to build on the success of these organizations. And then coming to the question about formulary, Senator Fisher, that you had about. So the formularies are basically a list of medications insurance companies have on their offerings. And all of these insurance companies work with a pharmacy benefit manager. So if you can think about a larger company which has, which for example is CVS, Optum, these are big, huge companies associated with multiple $1 million. And these companies have a monopoly in the mainland about procuring drugs. So they have negotiated contracts with manufacturers on obtaining drugs, and then the insurance companies contract with these pharmacy benefit managers. So pharmacy benefit managers actually can get a rebate which they're supposed to pass on to insurance companies and their patients. But pharmacy benefit managers do not do that. So as a service provider like GovGuam has contracted out their TPA to another company, GovGuam can say, okay, this is a formulary, we are having complaints from our patients, they are not getting an alternative, what is there in the formulary, can we change can you add this medication? Because there are medications in the, there are no medications or rather alternative medications in the formulary that the patient can use. So we've had a bunch of patients who were covered earlier this year and are not able to afford these high copays. So yes, there is an opportunity for the GovGuam to negotiate these formularies. So that's the perspective on that. So all in all, I do support the bill 355-37, especially with regards to the funding for GCTF. Thank you.
Thank you, Doc. Ms. Flores.
Hafa and thank you, Senators and Senator San Agustin and committee members. I'm Jane Flores. I'm the Director of the Bureau of Women's Affairs. Si Jus Masi for the opportunity to provide testimony regarding Bill number 355-37. I want to start out by acknowledging the difficult decision that all of you have with regard to this supplemental funding bill. I wouldn't want to be in your shoes because all of these programs are very viable, and I especially want to fully support the Todu Guam's Foundation's support, the Todu Guam Foundation's support, because we plan to work with them on our doula project if it is funded. The Bureau of Women's Affairs' interest in this supplemental funding bill lies in the one-time $400,000 funding in the bill that is proposed for the BWA Guahan Doula project. The goal of this project is to train women in our various cultural communities, Chamorro, Palauan, Chuquis, etc., to assist pregnant women or persons to have healthier pregnancies and healthier babies, and to educate women on the benefits of doula services. This, in turn, will help to reduce Guam's higher than the national average maternal and infant mortality rates. According to the U.S. Department of Health and Human Services Maternal and Child Health 2023 Needs Assessment, quoting, the MMR, or maternal mortality rate on Guam, reached a high of 30.4 in 2021. Guam's MMR 10-year average from the most recent 10-year period, 2008 to 2017, at 29.4, was still higher than the U.S. MMR of 23.8 in 2020. HHS reports that, quote, MMRs are still very high for Guam compared to the U.S., and the number of maternal deaths and the MMR has been increasing in the past 10 years following the national trend. The assessment indicates that, quote, the majority of these maternal deaths, 55%, were related to cardiovascular conditions or events, hemorrhage, cerebrovascular events, pregnancy-related hypertension. Another 7.5 infections with 10% non-cardiovascular conditions and 7.5% pregnancy-related conditions or events. Also, between 2017 and 2021, 161 Guam infants died before their first birthday, an average of 32 infants per year. The mean infant mortality rate for the 5 years was 10.71 per 1,000 live births, which is nearly double the Healthy People 2020 objective of 5.8 infant deaths per 1,000 live births. The highest infant mortality rate for that period was among Chamorros at 28.5 per 1,000 births. For all of the infant deaths that occurred in Guam during that period, quote, 46.6% of those who experienced an infant death were paying for their birth with Medicaid or MIP. In this period, people paying for their birth with Medicaid or MIP had a 90% greater odds of experiencing infant mortality than those who paid with any other form of insurance. The Guahan Doula Project would address these high rates by introducing doula care into the equation for women on Medicaid. According to studies conducted by the National Health Law Program, the National Academy for State Health Policy, and an article in the National Library of Medicine, doulas are effective at improving positive pregnancy outcomes, thereby reducing maternal and infant mortality rates. The effectiveness of doula services with regard to helping women with socioeconomic challenges to access prenatal care is such that so far, 12 states and Washington, D.C. have included doula services in their state Medicaid programs. And one state, Rhode Island, now requires doula services to be covered by private insurance plans as well. 6 other states are working to follow Rhode Island's lead because the data shows the effectiveness of doula services with regard to more positive pregnancy and birth outcomes, meaning healthier mothers and healthier babies. Governor Leon Guerrero and Lieutenant Governor Tenorio recognize the value of doula services to the women of Guam and support the doula services being added to the government of Guam's health insurance plan as well as to Guam's state Medicaid plan. We've met with medical professionals on our island, including OBGYNs, and with professionals at Guam Memorial Hospital. We've also met with the Medicaid team at the Department of Public Health and Social Services regarding adding doula services to our Guam State Medicaid plan. We have support from these entities and professionals for this collaborative effort to reduce our infant and maternal mortality rates. Also, I would like to address some misinformation and frankly some false information that's being circulated about this project. The primary goal of a doula is to assist a woman to have a healthy pregnancy, a healthy birth, and a positive postpartum experience. Doulas are not medical personnel. They cannot perform medical procedures, including the procedure of abortion. If a woman chooses to have a medical abortion, a doula, if called, can assist with support, if called, just as a nurse or a doctor can assist if a woman who has chosen to have an abortion walks into a hospital or into a clinic because she is bleeding from the procedure. However, this project does not in any way, shape, or form promote abortion. It is solely to promote healthier pregnancies and healthier birth outcomes in our community. Anyone who claims otherwise is completely and utterly misinformed about this project. Again, the sole purpose of this project is to help females to have healthier pregnancies and healthier babies and a positive postpartum experience. Sijus Masi.
Thank you. Ms. Agnes White.
Buenas and Half-a-Day, Senators of the 37th Guam Legislature. My name is Agnes Malilai White, born, raised, and living in the village of Tumuning, where I am a registered voter. I am a registered nurse and have been practicing for almost 4 decades, some years in the states of Missouri and New York, but most of them here on Guam. I'm also a cancer survivor, but I am not here to talk about funding for the Cancer Trust Fund. I would like to share with you 3 concerns that I have about Section 1E of Bill 355-37, which appropriates $400,000 to fund the Guahan Doula Project. But before I share my concerns, I want you to know that I am professionally involved in training community health workers in the areas of chronic disease management and diabetes self-management education. So I fully appreciate the role that a trained layperson without formal health education can play in promoting the health and well-being of our people. Moreover, I fully support efforts to mitigate the dismal maternal and infant mortality statistics mentioned in the original legislative intent of the bill, which was 138-37, which seeks to fund the Guahan Doula Project for the Bureau of Women's Affairs. With that said, my criticisms of Section 1E are the same criticisms that I lodged against the original bill 318-37. Firstly, it is unfortunate that public discussion by citizens promoting this bill seem to reveal that this bill has some questionable underpinnings, nefarious purposes as well. The Birth Workers of Color Collective had initiated a doula training, and the first cohort was trained late last year. In an article by NBCU Academy, which was dated March 28, 2024, a participant, a doula trained person by the Birth Workers of Color Collective, decried the fact that there were a lack of abortion facilities on this island. The same article quoted other participants who were inspired by this program to become abortion doulas. So, training involves training abortion doulas. So isn't it ironic? How ironic is this? That a doula who is trained to walk with a pregnant woman and to support her so that she experiences a stress-free, smooth, uncomplicated pregnancy and delivery of a healthy baby, would rather be trained also to support an abortion by the mother that will result in a dead baby? How tragic is that? So my first concern is that appropriation for Section 1E in this bill purports to reduce maternal and child health infant mortality, but will be really used by the Bureau of Women's Affairs to encourage the killing of tomorrow babies. Secondly, this appropriation contains no mechanisms whatsoever for public vetting of the approval of the content of the doula education programs that it will fund. You are asking for almost $500,000, but I don't know as a taxpayer where and how my money will be spent. It seems you have circumvented the mechanisms that demand accountability and responsibility for so large an amount. Lastly, the language of this appropriation must be perfectly clear that participants in any doula education who become certified will not in any sense be considered qualified persons to provide informed consent to patients prior to any medical procedure, but especially pursuant to the provisions of Title 10 regarding informed consent prior to an abortion. Doulas certified by the Birth Workers of Color Collective, the organization that the Bureau of Women's Affairs proposes to work with, are not trained health individuals and professionals. They are not licensed by the territory or state, which ensures a certain level of competency in the area of practice in order to meet and provide safe health care. Doulas are trained rather to walk with the mom before, after, and during their pregnancy to provide support and care and to allay fears and encourage healthy behaviors and attitudes. They're encouraged to be advocates for the mother because they understand the culture and are sensitive and competent. Yes, this is very important, but being qualified to obtain informed consent before a medical procedure, especially in abortion, is reserved for healthcare professionals who are recognized and licensed by the territory and state. A doula program that truly advocates for both mother and child is one that reflects the values of our island culture, namely the unwavering support of friends, the dignity of women and motherhood, the inherent beauty of childbearing, the incredible gift of children, the unconditional love of family, and a deep faith in the providence of God. A doula program that embraces these values will certainly reduce Guam's maternal and infant mortality rates way beyond 1/3 as was stated in the original bill. In closing, 671 letters opposing Bill 318-37 were submitted to this legislature versus the 14 which supported it. By passing Bill 355-37 without removing Section 1E, you have completely ignored and relegated the wishes and opinions of your constituents as trivial and insignificant. I urge you to strike Section 1E, funding for the Guahandula project in the amount of $400,000 from Bill 355-37 before passing this bill. Thank you.
Thank you. Dr. O'Connor. Mary O'Connor. Ma'am.
Hafidin, good morning, Senators. Senator San Agustin, Speaker Terlahi, Senator Chris Duenas, Senator Fisher, Senator Chris Malafunction Barnett. Thank you for allowing me this opportunity to speak on Bill 355-37. I provided written testimony this morning, and after hearing all the cries from all the other applicants for this funding, this bill appropriates $1.9 million to the Guam Community College to support the Western Interstate Commission for Higher Education Professional Student Exchange Program, which is called PSEP. And PSEP is to support scholarships for individuals that are aspiring medical professionals who, upon completion of their respective program, would be required to return to Guam and fulfill their obligation for a period of 5 years. We launched the program this year, or in 2024, and we currently have 3 students that are, 3 that are in pharmacy and 1 that is in osteopathic medicine. However, because the launch of the program is just for this academic year, and the amount of money that we have been able to secure for 2 students, 1 for pharmacy and 1 for allopathic medicine in the amount of $190,000. This morning I hereby request that you withdraw the amount of this appropriation so that I can challenge my staff to secure the funding needed for this fiscal year, which is in the amount of about $45,000, and we will include the funding necessary in our fiscal year 2026 budget request. And so I want to update the testimony that I provided this morning so that we can identify and work towards securing other sources of funding and requests for what we need in fiscal year 2026. Sidusmasi.
Thank you, Dr. Okada. The next testimony will be provided by Sharon Omelon. Ma'am.
I provided written testimony. I submitted it, but I'm also going to just talk real briefly before that. It's sad that all these cancer patients had to come out and offer testimony, because that's what this bill is basically doing. It's throwing all these things into a bill muddled with so much stuff. I saw earlier a cancer bill being introduced, bill number 353-37, and I looked for that because I was waiting for that, and I was hoping to testify also for that, because I had heard from a senator, 2 senators actually, that they were hoping through that bill going through at public testimony, they could get an increase from that $2 million. And then just now listening to Senator Telo Taidegui saying she was hoping for $4 million. This is what I was hoping would happen with this bill number 353-37 when it came to a public hearing. I can't even remember who presented the bill, but I'm sorry, Senator Barnett is raising his hands. I'm not sure if anyone else was on the bill with him. But this, Senator Terlahi, I really don't remember who, I'm just...
Ma'am, and Senator Perez as well.
Senator Perez, I'm so sorry. It's just that when this bill came out, number 353-37, I was willing to come out and put public support to this bill and to increase it. And I'm hearing she was asking for $4 million. I was even going to say maybe more, and I was going to testify to that. I mean, it was very personal to me. I wanted that. But then I see that it was thrown into this bill, 35537, as here we go again, to cover up for all the other stuff. And it was just very disappointing to see that 35337 is not going to get its personal hearing and probably its true justification of what it needs to do, fund the Cancer Trust, which is so important. Very personal to me. And so listening, basically everybody here was coming out to support the Cancer Trust. We all do it. And this is shamefully why this was put here on this bill, because it's trying to cover up. They even put a COLA here, hoping all the retired people would come out, oh yes, we want this bill to pass, oh yes, because I want that money. It's so shameless what was done with this bill. And I actually came here to testify, and I will start my testimony here. I oppose bill number 355-37. Dear Senators, we are attending this public hearing for bill number 355-37. Thank you for taking the time to attend and listen to anyone wishing to present verbal testimony. I am here to oppose this bill number 355-37 mainly due to the fact that included in this bill 355-37, item E is the very same item that went to a public hearing under bill number 318-37. If you recall, bill 318-37 was presented to the public, and then eventually a committee report was done and presented. I don't know if any of you reviewed the 877 pages of the committee report for bill number 318-37. In this bill, which is the very exact thing that is being requested under this new bill, 355-37 under the E, over 671 people opposed the bill and only 14 supported the bill. I think that literally means that bill was killed. I thought that's what committee reports reveal, what the people want. I thought that's what the committee report does, and I thought that's what our senators listen to, what the public's asking. So in essence, the people have spoken, and they rejected bill 318-37. Yet here is the same item being shoved into the middle of a new bill, 35537, jam-packed with so much stuff that you thought no common person would notice. Senators, the $400,000 requested for the Guam Bureau of Women's Affairs to fund the Guahan Doula project was rejected by the voters who I thought you worked for. Why are you completely ignoring this? Is this a legitimate practice by the legislature or its supposedly honest senators? What are you doing? See in this bag? I brought it with me. We went over the committee report. This is 671 people going against the doula bill. You're ignoring this. Senator Chris, this are the people opposing that bill. I'm just saying.
Ma'am, just continue your testimony on the bill.
Well, it's being ignored. I'm just saying because you were looking down. I just wanted to make sure. So, in here is a copy of the committee report letters. This bill 355-37, I don't know who it is going, where it is going, but the section E needs to be removed and amended out. Disgraceful. It was a disgraceful move. As to the rest of this bill 355-37, I couldn't help but notice how obvious it was in trying to throw anything into the general public like they are animals grasping for something. You have people here groveling for their money. It's a shame. The very first item A had to do with giving COLA money. Whoa, that's a very cheap shot. Then the bill was all over the place. I couldn't help but notice that some of the items here are already on other bills presented on the Guam legislature's bill submitted. Example in regards to the Cancer Trust Fund, item Q. This was presented on bill 35337. Bill 353 was submitted prior to this bill 35537, yet somehow this 355-37 was out for hearing first. The item L for the PTOs was already submitted under Bill number 34637. In fact, there were a lot of duplicated items on this Bill 35537 that it just doesn't sound right. How could you put 20 completely separate items into one bill without each item being properly vetted? This sounds absolutely crazy. I know you're saying that this is a supplemental bill. No, it's not. This is a political thing. This is pure politics, and it's silly because the games you are playing with your general public is shameful. Who are you people? Have you forgotten decency and respect for the general public, or are you lost in some political game? Shame on you. Some of you I voted for. I sit here and I look at you all, and I don't know what happened to you. Everything is a deal. I vote for you, you vote for me. I personally am so saddened to see this. So back to 35537, I cannot support it and forcefully ask for Bill 35537 to completely remove item E since it was already discussed and rejected by the people. Thank you.
Thank you, Ms. Omelon. Dr. Swanson, sir.
Oh, I'm sorry.
I'm used to this. Good morning, Senators. I'm here to provide testimony with regard to Bill 35537 and some insights into there are 4 sections in the bill that bear directly on GDOE. The first being Section B, that's asking for setting aside $10 million for maintenance repair. I'll get back to that. Section L, the section providing $205,000 for PTOs. And then Section N is particularly important to us. This is providing funding, $1.5 million to Guam Police Department for school resource officers, and I'll speak to that in a moment. And the last being Section O, which is the opioid antagonist, that's otherwise Narcan provision. As I look at listen to the testimony today and also look at the list that's here with regard to the 2 that are outstandingly important to us as an organization and to student safety and health, is a provision for maintenance funding and repair. This is currently requesting $10 million. As you know, we've been working through hand in hand with you and the governor's office and the rest of the community, bringing our facilities up to standard. Now we're to the point where, as of today, we've finished the last of the inspections for schools being brought back up to standard. But that was to a minimum standard. We need to now continue, and we used a lot of that funding came from the ARP grant, which is now closed. So we have to provide for ongoing maintenance so that we continue to work our way out of the deficit that's been created over years of neglect. And whether or not we can achieve in this bill, because I understand the crowding of requests against available funds. The original budget proposal that we put into the GDOE budget was for $5 million for maintenance repair. We need at least that much to continue to do the work we do. That was because of the budget allocation that we spoke of earlier that came in $47 million less than was what was requested. That $10 million or $5 million in this case that was requested in the budget is eliminated. The other one that is extremely important to us, I've spoken with Chief Ignatius and with my security staff, is that funding for school resource officers is absolutely essential, and we had provided in our original budget request a request for $2 million to that same end that would also include the alarm and security systems. So those are the 2 that are the most important. We can find the funds to do the other things that are here, and certainly work with our PTOs to provide fundraising opportunities. But the 2 that I really want to speak in favor of that we support is 1B, the maintenance and repair funds, and 1N, the $1.5 million for Guam Police Department. Those 2 are the most important. Thank you for your time and consideration on this.
Thank you, Dr. Swanson. Now I'll ask my colleagues. Madam Speaker, do you have any questions for the panel on their testimony? Yes, Madam Speaker. In reference to the testimony, okay?
Of course. Good afternoon, or yes, almost afternoon. Good morning and afternoon to everyone. Thank you for being here and waiting to testify today. I know it's very important for you to be heard. Just a couple questions. First of all, could I just ask Total Guam, the gynecologist, does that provide OB services as well for maternal care?
Yes, our OB-GYN, Dr. Sylvia Cruz, provides both OB services and GYN services. And so, you know, although we talk about the ENUMERATED program, particularly looking at cervical cancer screening and prevention, you know, one of the things that we did promise GCTF, because when we went through the process and they were questioning us about if women had other needs, would you take care of those needs? And our answer was a resounding yes. So we do provide comprehensive women's health care services, and that includes both OB and GYN services.
Covered by Medicaid?
So we do assist patients who could qualify for Medicaid, you know, to go ahead and go through that process, support them through that process and get them insured with Medicaid. But you know, as Senator Rodriguez pointed out, we do have a portion of the population that does not qualify for Medicaid or MIP. You know, they may be in an income bracket that's just above. Okay. And so we do work with them to try to provide those services. Sometimes their care is funded through the foundation's
all right,
foundation portion. Yeah.
So, and Ms. Flores, did you say that you said you had asked the governor to include doulas on the GovGuam insurance? Are they included in the FY25 GovGuam insurance?
I am not sure if they are included in FY 2025. We are working to get them to include it in FY 2025. So if that program has, I think they're waiting to be included in Medicaid first, I believe. Because most of this bill is going toward women who are on Medicaid and not on private insurance.
Most of what is going to women?
Most of the services are pointing toward women on Medicaid as opposed to private insurance. So we wanted to work with Medicaid first.
All right. And Mr. Swanson, well, first of all, thank you to GCC President for your comments and suggestions. And we do appreciate your efforts with this WICHI, not efforts, but your successes, actually. We've seen the results and in the testimony how persons on Guam have availed of these programs, and we are actually, I know our focus is to increase health care, so it's kind of very complementary to all the other efforts going on, is to increase health care professionals on Guam, so I really thank you for that. Mr. Swanson, on the GDOE, I just want to ask you about the $1.5 million for school resource officers. That would take care of your security concerns at the schools?
Not entirely, no. The school resource officers provide a presence to diffuse situations on campus, and they would be in our high schools and support their feeder middle schools. And their role is to be the visible part of law enforcement, which really does make a difference. But also they have extra training in working with young people so that we're really modeling the way we need to have them behave moving forward. And as I mentioned in testimony the other day, when you see a uniformed officer, it changes the tone almost immediately. Just like when you see one in your rearview mirror, you tend to check your speed. And so sometimes that is the biggest help that some of our high school age kids can have. But that's an accepted model used across the United States, and the other side of it is the physical security and deterrence for folks that might want to be impacting a school with firearms or some other illegal activity. It does make a difference.
All right, and so you had put this in, you said you had put $2 million in your original budget request for this.
That's correct, and that was the chief and I are coming at this from both sides as to really try and get the program up, and the balance of the $1.5 million to $2 million was for the physical surveillance equipment that we would need to upgrade our.
All right. And if so, we gave you the 10 plus the 1.5 or 2 and allowed you to use it for either of these purposes, maintenance or security, you'd be able to.
It would be both. First of all, the SRO program, and then ramping up our security infrastructure that's really lacking.
All right, and then you said all the schools have been inspected today? You said today all the schools will have been inspected?
Yes. I don't have the official reports.
Well, but congratulations, at least you got them all inspected. So we have an assessment pretty much of all the schools now.
We should be, as soon as I get the release from Department of Public Health, then we'll have everybody back on their own campus.
All right. Well, I want to thank you for all your work in that regard. I know it's been difficult. Thank you, Mr. Chair.
Thank you.
Well, can I just say also for the Guam Cancer Trust, yes, it was one of those things I thought, like when I said earlier, so we did attempt several things during the budget process. First, the fiscal team from Adelup was suggesting that we could raise revenues. They sent us a letter saying, raise the revenues and cover these programs. None of them included GMH or the Guam Cancer Trust Fund. They included other things, but they were supporting raising FY25 revenue projections for additional expenditures. But those types of amendments to the budget bill were absolutely defeated. I'm very encouraged to hear today some of my colleagues professing that they're going to vote for those things now. I will see what happens. We tried also to, make sure the Guam Cancer Trust Fund percentage was honored, but the way the budget bill was worked, it wasn't as it was presented on the floor. So we tried to use FY24 revenues, as you heard earlier. All the 24 excess and 25 excess revenue amendments were pretty much moved by a motion off of our table. And that was also very troubling, because I agree with the sentiments of one of my colleagues where we need to settle these things before the fiscal year begins so that people can begin the fiscal year knowing exactly what we can project in services, especially healthcare. And then we tried so hard to put some money, right? And our only options left were to cut some other services, which also are, very important, but that's kind of like what we're left. And that's kind of like what we're left with this bill. Some of these bill services in this supplemental bill are going to go into public safety. And if we do what we're talking about this morning, putting $20 million to the hospital, $2 million to Guam Cancer Trust Fund, 10 or 12 to GDOE, that's everything. That's all the revenues that we've got to deal with at this point. But so at that point, we were trying to cut other agencies that were in the budget. I got a lot of flack for that, but I was able to bring over a mere, $300,000 for Cancer Trust Fund, a little bit to Guam Behavioral Health, a little bit to DISIT that needed it, those types of things. Yeah, I don't think that's how we should be doing it. I think we should prioritize our healthcare systems. I wanted to ask, well, Ms. Flores, I did have another question for you. That was regarding the infant mortality statistics and the maternal healthcare statistics. I don't know if you were watching our hearings in the last few months regarding the closure of the Manilao Public Health Building, where we had the professionals, the healthcare professionals, the nurses, the doctors, and the public health chief officers come in and tell us those statistics really dropped according to their data upon the closure of this Manilao building. So I just wanted to put that on the record as well. So they show us statistics and saying that was really what it, well, not all that impacts, but that's where the maternal child, the infant care and maternal care was really being provided. And so cutting that building and the services that it was providing was really having an impact as well. All right, thank you, Mr. Chair.
Thank you. Senator Barnett, do you have any questions to the panel in reference to their testimony?
Mr. Chair, and again, good afternoon to the panel. Thank you for spending just a little part of your lunch hour with us. Sue, good morning. I guess I just wanted to first ask, and again, I want to thank the Appropriations Chair for including most of the amendments that I had introduced to help support the Guam Department of Education. But on just item B, the sum of $10 million to GDOE for maintenance and repair of GDOE schools, the language it's pretty strict. It says you're going to use that $10 million for maintenance and repair. But I just want to ask, given that you were shorted $47 million, do you need any flexibility with that $10 million in terms of being able to use a portion of it, a part of it in other areas?
Operationally, yes, but I also have been advocating all along that we have a dedicated fund for maintenance repair because that has not been in the budget in years past. Yeah. And look where we ended up. So I really want to be able to put together an aggressive maintenance and repair process, because in all of the cases that we've had variances, when we come back for reinspection, which we are starting that cycle right now, we're having reinspection start this week for ones that were done last year, we have to address those areas that had variances and show how we mitigated them, which means in many cases we had to replace something that we weren't funded for before. So that ability to dedicate that money and know we have it, because some of it needs to be contracted, and that will give us the flexibility to do that.
Thank you, Mr. Superintendent. I kind of want to just echo the comments Speaker Terlahi had put on the record. We've had, as a member of the Health Committee, I attend most of the hearings that she has, and we did have a hearing on, it was relative to the public health Manila facility, and we heard from the experts, really, the nurses and the public health officials who have their boots on the ground about the, and I keep saying it's troubling. It's an embarrassment that we have this infant mortality rate and this maternal mortality rate on a territory that flies under the U.S. flag. But these public health officials are very clear in what has contributed to that infant mortality rate and the maternal mortality rate, and they said it was the closure of the Manila Public Health. They said when we close the Manila Public Health, prenatal care, postnatal care, access, the number of people they were able to deliver those services to decreased by 50%. 50%. That means they are getting critical prenatal and postnatal care to only half of the people that they used to. And so when Mrs. Flores read the testimony about, and I'll just reread it. The assessment indicates that the majority of these maternal deaths were related to cardiovascular conditions or events, infections, non-cardiovascular conditions, and pregnancy-related conditions or events. And later in your testimony, you said that doulas are not medical personnel. They cannot perform medical procedures. And so I just don't see in my mind how doulas would address any of those areas where we're seeing the impact to kids and mothers dying. It's not a question, ma'am. And so we get in here in this supplemental budget bill and we're forced to make these tough decisions about prioritizing critical services that were shortchanged across the hall. And let me just say for the record, we had $27 million in excess revenue sitting on the table. The Cancer Trust Fund is asking for $2 million. You do the math. We could have easily gave you that $2 million across the hall and you wouldn't be here today. You wouldn't be here today. Start of the fiscal year, you would have got your funding. things would have kept moving. That's not politics, those are just the facts. So when we come in here, we have to make these tough decisions about prioritizing the care of cancer patients versus our public school system, versus scholarships for critical needed medical personnel versus funding for non-medical personnel. I mean, we've got some really tough decisions in front of us, and that's what we're elected to make. So thank you, Mr. Chair.
Thank you. Senator Fisher, have any questions for the panel?
I do. Thank you very much, sir. I want to talk to the Todo Guam Foundation here in a minute, but I just cannot pause without giving Ms. Flores an opportunity to answer the question. Ma'am, how can doulas, which they have a proven track record of doing so, how can doulas help to reduce infant mortality, even infant mortality that is due to, and maternal mortality that is due to cardiovascular events?
Well, these doulas are trained to help women have healthier pregnancies by meeting with them when they first become pregnant, helping them with diet, exercise, things that the hypertension especially, you know, with the way they eat, the way they don't exercise, to just help them with any kind of questions, and then also direct them to medical personnel or to how to get to medical personnel if they are having a symptom that the doula says, well, you need to get this checked out by a doctor.
Okay, and just to ask an extraordinarily obvious question, is a healthy pregnancy more likely to produce a healthy birth?
I'm not a doctor, but I would think so.
Just kind of makes sense being a human, right? Okay, I just wanted to lay that out on the table because I'm not afraid to hear that answer. So I will come back to you in a moment, ma'am, but if I could just speak to the Todo Guam Foundation. Sir, and this is to you, Senator Rodriguez. You are head of the Todo Guam Foundation?
Yes, I'm a co-founder.
Co-founder. You say it's 7 years old now, right?
Yes.
You must have, when you and the other co-founders came together to form the foundation, you must have identified a need that needed to be addressed. Is that correct?
Yes.
Could you expand on that?
Sure. Well, when we started this back in 2017, you know, I was here as a member of the legislature. I was the oversight chair on health. And so at that time, you know, I saw firsthand the problems you see today. You know, the lack of access for our people, even if they had Medicaid back then, it was worse than what it is today. I think things have improved where people on Medicaid can still go to clinics and be able to get access there. And so we saw that, and so we said, you know, we got to bring our community partners together. And so we did. We got, you know, doctors and nurses, other allied health professionals together. And we did it on a voluntary basis for many, many years. And so we've done that. We saw the need for access to basic health care. As I said earlier, we believe prevention, early detection is the best solution. And so that's what, you know, we've been doing.
Does the Todo Guam Foundation care how much money you have?
I'm sorry?
Does the Todo Guam Foundation care how much the clients have money?
No, absolutely not. I mean, you know, we also have a program, a sliding fee discount program that, you know, because we have to be responsible as well. And so to be able to sustain our operations, we get zero money from the federal or local government to subsidize this program.
Do you care about skin color?
No, I mean, we definitely don't look at that.
Do you care about national origin?
No.
I'm sorry?
No, we don't.
Do you care about sex?
No.
Religion?
No.
Sexual orientation?
No. No.
Everybody gets service?
Absolutely.
Good for you. I thank you for that. It's just a wonderful thing. Thank you very much to the Todo Guam Foundation and everybody who's helping out with that foundation. I didn't catch your name, ma'am. It's Dr.
I'm Dr. Lee.
I'm sorry.
Lee.
Lee? Mm-hmm. Okay. Ma'am, you stated that early protection or early detection and protection can help in women's health care. Is that true?
Yes, that is correct.
Why is that?
Okay, so I mean, I think when we're looking at cancer, right, what we're really trying to do is we're trying to detect cancer early.
I'm sorry, I've got it.
I'm sorry. What we're trying to do is we're trying to detect cancer early when it's, and identify and treat it early when it's more curable. And so cervical cancer is actually one of the cancers that we have identified as actually being able, we can eliminate cervical cancer with the tools that we have in front of us. Most cervical cancer cases are actually caused by a HPV infection, right? So that would be like 99.5% of cases. And so through vaccination, we can help protect against that infection, or at least prolonged infection with HPV that leads to the changes that eventually lead to cancer. So that's primary prevention for cancer right there.
Now, in order for the prevention, I think, to move forward and to work successfully, people have to know that the disease exists and that it is treatable. Is that correct?
Yes, that is right. And that's part of what we do, right? Like I said, as the senator and I have both shared, we take care of the underserved. We take care of patients who have had problems accessing care for one reason or another. Okay. And part of what we do, and you know, I can speak to this firsthand as a provider, is we educate patients about the importance of seeking care. We educate patients about the importance of seeking regular care, and we teach them how to access the system. Additionally, we provide them with the support they need to find the resources they need so that they can continue to access care.
Okay, excellent. You would also, well, I'd like to, so are you reaching out to communities to let them know that a vaccine is available?
Yeah, yes, sir, we are. You know, so we've done this in a few ways. One of them has been through an informal partnership with GDOE as well as with Cancer Care. We were in the schools through 2023, you know, helping with the HPV vaccination effort there. And again, that was supported both by American Cancer Society as well as funds from the Guam Cancer Trust Fund. And then through our ENUMERATED Ifamalawan program, we have marketing that is specifically targeted to the marginalized, to populations that don't access care, inviting them and educating them.
How can marginalized, how can any community afford the vaccine? I wonder, I think it runs about $300 a treatment, doesn't it?
You are correct, sir, that it's about $300 a dose, and then to add the administration fee to that, it'll be about $350 per dose.
$350 per dose?
Per dose.
And how many doses are required generally?
So if we get you before age 15, if we vaccinate early, which is recommended, then it'll only be two doses. But if you've turned 15, it's your 15th birthday, or later it's 3 doses. It also 3 doses for special populations like the immunocompromised. Okay. Thankfully, through our partnership with the Department of Public Health and Social Services Vaccine for Children and Vaccine for Adult program, we can provide some of these vaccines for the uninsured and the underinsured, as well as through our support from funding from the Guam Cancer Trust Fund. Okay,
thank you for that answer. You were speaking about the tremendous expense of it. 3 doses is going to run you over $1,000. Is this because Guam is not able to negotiate with the insurance companies?
So when I talk specifically in terms of the cost, right, I'm talking about the actual cost that we pay the vendor for the vaccine. So it's about $300 a dose, and this has been quite a change. Prior to this, it was maybe $175 per dose, and this change in price came about 2 or 3 years ago, if I'm not mistaken. Wow. And part of the challenge is that out here in the Western Pacific, we don't deal directly with the manufacturer. So we go through like 3 middlemen before we can actually receive supply. And because our population is, you know, can't compare to a state that has millions of people, right? So our order is very minuscule compared to the states. As a result of that, it's the laws of price and demand, as economics would tell you. And so our demand isn't as high as a population that's in the millions. And so each dose is going to cost more for us, especially because it has to go through several middlemen before it can be distributed to us.
Sure. Medicare, Medicaid was able to negotiate with the drug manufacturers to bring down the price of diabetes medication down to $35 from God knows where it was. Do you know, you may not have the answer to this, but do you know whether or not Medicaid, Medicare is negotiating with whoever it is, SmithKline or whoever it is, to lower these prices?
I think it's because, you know, Medicaid and Medicare set their terms in regards to what they're going to reimburse the provider, and that it's the provider who has to deal directly with the supplier. So it really is a matter of the suppliers here on Guam and the providers here in Guam need someone to advocate for us in order to make the vaccine more affordable per dose. And so we've tried to look at this from a collective level. I've gone to regional meetings 2 years in a row now, trying to speak collectively as the Pacific to try to maybe order in bulk for the Pacific Islands so that we could reduce the cost of the dose. And we haven't been successful yet in organizing that.
And I don't have the answer to this, but maybe that drug's going to come off patent pretty soon, in which case the price will plummet. I wanted to ask you about, you stated, I think maybe I misunderstood, that cervical cancer is the third leading cause of death in women? In
resource poor areas. If I have to speak specifically to Guam, right, in terms of like the most recent published data from, you know, through public health, for which I was the lead author for 2013 to 2017, and that's what we've most recently published. I know we have more recent data, but I have not been privileged to review that. For both incidents in terms of new cases, as well as for mortality, cancer-related deaths, it is number 5 for women here on Guam. Okay, so it's still top 5 cancer here on the island.
Cervical, well, okay. Cervical cancer can be caused by the presence of the human papillomavirus,
yes, correct? That is correct, sir.
In women. Is it also a disease that men can suffer from?
Okay, so HPV infection is arguably the most common sexually transmitted infection. Our estimate is that in the sexually active population at any point in time, 80 to 90% of the population will be infected with HPV. Including males? Including males, yes, sir. And so HPV is actually linked to 6 different types of cancer, including oropharyngeal, penile, and anal cancer. So those are the 3 out of the 6 that can affect men. And in fact, that their incidence in terms of HPV-related cancers is almost at the same incidence level for cervical cancer for women.
And it is preventable?
It is preventable, sir, in the sense that we have a vaccine that is primary prevention, right? Because the way cancer comes about after HPV infection is a prolonged infection. Right. So you may still get infected, but by being vaccinated, this allows your immune system to be better capable of getting rid of the infection before we see these precancerous changes. And then thankfully, in the case of cervical cancer, we have very effective screening methods that can help us to detect precancerous changes. So as long as a woman receives follow-up care, the proper follow-up care from her abnormal results, she'll never have to be diagnosed with cervical cancer. Okay. We could stop that from happening with the proper follow-up care.
Okay, thank you for that answer. You mentioned that HPV, human papillomavirus, is a sexually transmitted disease?
Yes, sir.
Okay, do you want to vaccinate people, ideally, before they become sexually active?
And so the evidence shows us that if we vaccinate you prior to sexual activity, the vaccine's more effective. Okay, so that's why we advocate vaccinating early, and we can start as early as age 9.
Some jurisdictions, some school systems have adopted a policy to have mandatory HPV vaccines for roughly the 6th, 7th grade population. Do you think that would be wise?
I think, you know, all of us have heard testimony this morning about the burden of cancer here on the island. I myself, my mother had 5 different types of cancer, and we went on 3 different cancer journeys. And I count myself I'm very grateful that we could support my mom through that without having to seek resources. And it's just, you know, I don't know if Dr. Amali will agree with me. Cancer just doesn't behave the way we expect it to behave here. As Senator Sablan offered to you, We see a lot of cancer cases that we just don't expect to see in a particular age group. We see very unique cancers. We see very aggressive cancer. So, you know, I admit it, my personal bias in the sense that I've been on a cancer journey with my mom, with all of my patients. And I think any effort that would result in reducing the cancer burden here on island, especially when we see that disparities exist within the ethnic groups here, you know, I would definitely support in terms of, especially something that we know is effective at primary prevention.
Okay, thank you very much. I'm going to move on, but I do appreciate all your answers, and congratulations to Todo Guam Foundation. I think you folks are doing God's work, so thank you very much.
Thank you.
Doctor, I'm sorry I didn't catch your last, is it Sima?
Samir Amali.
Okay. Sir, you were talking about this, and we just briefly talked about the idea of negotiating drug prices. Do you know whether or not GovGuam, now that we are essentially self-insured, all the employees, do we have leverage to negotiate, or are we, as Dr. Lee just observed, we're too small a market to have that leverage?
I don't know if they are negotiating, but Guam, I believe, is the biggest employer in Guam. So there could be discussions between GovGuam and the TPA about certain formulary exceptions or additions, deletions, depending on their members' benefit. So if somebody comes to you saying, I know this is a medication that I was prescribed, there is no alternative, and I can't go without treatment. I have no options of treatment. Yeah. There are a few patients we've been advocating about these, and these are the patients that can be helped by negotiation between GovGuam and the TPA about talking to their pharmacy benefit manager and changing formularies, updating formularies.
Yes, sir. And then I'm going to go back to Ms. Flores here, but I just have to comment. I think that the distribution of health care in the nation and on this island is absolutely disgraceful. There are millions and millions and millions and millions and millions of people who literally have to go home and die when they get a diagnosis like this. And it's unsustainable. Ms. Flores, if I could just ask you a couple of questions, and this is, for the most part, related to the doula bill. We have heard this cacophony of misinformation just over the last 2 weeks. I think it almost seems like there's a concerted effort to torpedo this idea. But we keep hearing this foolishness about abortion doulas. You've heard that phrase before, haven't you?
Yes.
What is an abortion doula? And is this program designed to encourage abortions?
This program is not designed to encourage abortions. Like I said, if a woman, because abortion is legal here in the U.S. territory of Guam, if a woman takes medication abortion and she's scared and she's bleeding and she calls a doula and asks her to help, if that doula can or if that doula wants to, she could help, the same as if she called a nurse like Mrs. White or someone else and that nurse decided to help her or tell her to go see a doctor. That is what they would do, but they can't assist medically through the procedure because it's, so
I can tell
to
you're
say
frustrated.
that someone is an abortion doula and helps that person to facilitate the abortion that's not a correct term. If I don't know why, any medical personnel I would think would help someone in need.
I would.
Or any person would help someone in need. You would like to think.
I would, yes, ma'am. I sense your frustration in having to deal with this issue, and I would just submit to you, Ms. Flores, that these discussions and arguments and suggestions of this concept of an abortion doula is made in bad faith with an attempt to destroy this very good program. So I hope that I know that they will not succeed, ma'am. Let me ask you a question about the doula program itself. Do doulas push their personal religious beliefs on clients?
No.
Okay. Do doulas judge clients on the decisions and choices they make?
No, they're to help the client with whatever decision they make.
So they ought not to be making religious witnesses to them and so forth. Is that correct?
I would think not.
Okay. Now, you are head of the Bureau of Women's Affairs, is that correct?
Yes.
And the Bureau is designed to bring, I suppose, the women population into closer into public life and to enjoy the benefits of all public life?
Yes, presumably, yes.
Okay. And does, in your program, the doula program, as well as the Bureau of Women's Affairs, do you reach out to marginalized communities, the poor?
We try to, yes. We try to work with marginalized communities, especially the women's groups around the island.
Okay. Now, I'm going to ask you a series of questions that I just asked the Todu Guam Foundation. Do you provide services based on a person's wealth or lack of wealth?
Well, with the doula program, we try to target women who are socioeconomically challenged because if you have health insurance, then you can avail of that.
Okay. Is it relevant to you what a person's national origin is?
No.
Is it relevant to you what a person's sex is?
No.
Is it relevant to you what the person's skin color is?
No.
Is it relative or relevant to you what a person's sexual orientation is?
No.
Okay. In the doula program, do you, I guess as part of your philosophical makeup, do you respect personal choices?
Absolutely.
Do you respect the right of an individual to dignity and choice?
Yes.
Thank you for that. Ma'am, I want to assure you that we are not going back to a period. We are not going back to a period where women's rights are subject to political whim. It's a constitutional right, and by God, we're not going back. Thank you very much.
Thank you.
Thank you. Senator Range, do you have any questions for the panel?
Jesus Masi, Mr. Chair, and it's so impolite for me to stand between you and lunch, so I'm going to make it very short. Dr. Swanson, when I was able to get the $20 million additional appropriation to Department of Education, I remember it was your testimony and the testimony of your team during the Committee of the Whole that you had intended for this $10 million that's recognized in this bill to once and for all eliminate deferred maintenance and try to not get us back in the situation we are with our schools now. Is that correct?
That's correct, Senator.
Thank you very much. And unfortunately, just two more points. Unfortunately, I'm sure the hospital folks are really, really busy, and I'm glad they didn't have to stay around, but I want to make it clear that this body, up until last year, had been appropriating between $3 and $5 million annually to the Guam Memorial Hospital. It was after a public hearing which showed some dismal situations at the hospital that we recessed, passed a resolution, and then went in. And for the first time during a fiscal year, led by many of our colleagues, passed a $30 million appropriation which got GMH out of the situation that they were in. And that's why I'm glad now they're finally putting it in their budget. It was double the number that they requested this year, but we're going to do everything we can to get there. This is an important point that I want the Cancer Trust Fund folks to take away. When the bill for the vapes, which we're going to vote on, was debated on the floor, many of us wanted to put the new vape revenue, at least 50% of it, to the Cancer Trust Fund. Because we knew what was happening. There was a correlation of, hopefully, and we believe, a reduction in tobacco use. There's probably a corresponding increase in vape use. And so the idea was, let's do everything that we can to replenish that money at least. It was defeated on the floor, unfortunately. But here's the good news. There's an escalation in that bill that actually changes it over to 20% after time certain. So as we track this fund, I hope many of us, whatever the decisions of the people are going forward, that we continue to recognize the need of the Cancer Trust Fund and replenish those funds with the additional revenues that are coming forward. I know there's a competing interest with GMH, but we have other appropriations for that as well. But as the fund was established, and to make you whole once and for all on your percentage and possibly more, as Doc said, I'm going to continue to advocate that that's what we do with that funding, because it really is a correlation as far as I'm concerned and should replace the good work that you do. With that, Mr. Chairman, I hope we're all able to go and get a bite here real quick, and thank you for your patience and your time. Susan Masi.
Thank you, Senator Duenas. And for the panel, thank you for being here. But let me just close with a very short statement, okay, in reference to the budget process. And Senator Rodriguez is very well aware how we do the budget. When we do the budget process, the Office of Finance and Budget invites the senators to come and see the budget. Come and give your comment, your recommendations, so we can make the amendments. When the budget came out, the folks that did attend, the appropriate amendments were made. The folks that should have attended, that oversee certain agencies, didn't, or they did send a staff, but there was no changes. So when anybody wants to cry over spilled milk, it ain't me. I present things and we see where it's going. In the past 2 years, we did help the Quambo Cancer Trust Fund. It was $3 million. This year it happened to be $1 million. You know, when they made the comment of 15% of 23, it's not 3.5. You know, 10% of 23 is 2. So no way it's going to be 3. But we're going to do our best in this budget and this supplemental to make sure they get their total 3. So that's an easy one. GMH has problems. The question is going to be, how is DOE going to be fixed? But the body will decide that. Okay, this is not a Senator St. Augustine. I'm just the chairman. I put the package together and says, okay, here, folks, what do you really want and where you want to go? Don't point fingers. Come and fulfill your responsibility as a senator and do your job. Speak about the people, figure out what we need to get rid of or what we need to add, and we just move on. And with that, there's no one else to present testimony in this bill. This hearing is now concluded.
Mr. Chairman? Can I just, I'm sorry, you know, if you can just indulge me. You know, with the budget, I know the fiscal year ends September 30th. With the Guam Cancer Trust Fund, and I think the other recipients can also speak about it, is there was a call out for the new proposals for the new fiscal year, but it doesn't, the contract year doesn't start till November 1st. And so we're right now in a holding pattern. You know, we've submitted, there was a deadline to submit proposals, which was, I think, in September 20th. And so right now, as of today, October 31st comes around and there's no additional resources for the Guam Cancer Trust Fund, then, you know, what we've talked about will happen. You know, Guam Cancer Care has talked about shutting down effective November 1st. And so, you know, just a little bit, because I do know a little bit about the process, I know things have changed, but that's the urgency that we who are recipients of the Guam Cancer Trust Fund face, is that the timing is that if the university who is the stewards of this fund doesn't receive that appropriation, then you know, what we say we don't want to happen may happen. So just a little bit of information.
What's your deadline? What's your deadline that we're worried about getting the $2 million?
Yeah, October 31st is our contract year.
Okay.
And so now they have our proposals, and so I'm just anticipating they won't move forward without.
I will commit that my staff will put the committee report together quickly, ask my committee to sign off on it so we can get it in October's session.
So do small seat, Senator.
Okay, you know, we'll do what we can. And if need be, if the body wants to, it can be faster. You know how that works, Senator Rodriguez, because we've done it before. When we want to get something, we just get together and we just do it. But I will commit, my committee report will be done by next week. As a matter of fact, yeah, they're already looking at me like, oh God, by next week it'll be done. Okay, we move as fast as we possibly can, humanly can. But we have an effort to get things done. Then we'll figure it out from there. And with that, I want to thank everyone for attending this hearing and providing feedback and suggestion. Bill number 355-37, public hearing is now adjourned. The time now is 12:35. Please be safe. Take care.